फिर से. Ladies and gentlemen, our chief guest will arrive in a moment. Till then, please take your seats and keep your phones on silent mode. So it's my humble request once again to put your phone on silent mode. Thank you. Thank you, ma'am. Thank you. Ladies and gentlemen, our chief guest will arrive in a moment. Please, it's my humble request to please take your seats and keep your phone on silent mode, please. Thank you. हाँ, ये तो है अराइविंग सून. एड्रेस थोड़ा, उसके बाद है
नेशनल एंथम. ये क्या कर रहे हैं आप? ये बुला
सर,
रहे
ये
हैं. वेलकम है.
प्लेजेंट मॉर्निंग टू एवरीवन एंड ऑल.
ठीक है, ठीक है.
उसके
डॉक्टर
बाद
गजाला.
नेशनल एंथम.
ठीक है.
उसके बाद इल्यूमिनेटिंग ऑफ लैम्प.
ओके, डन. ओके, गॉट इट.
सर वही है ना, जैसे आप बता रहे हैं.
ऐसा बात हो गया सर। जैसे आज दोनों दिन के लिए कर दिया है। हाँ? हाँ वालेकुम अस्सलाम। डॉक्टर साहब कहाँ रह गए?
सर जाम आपका दिल्ली का जाम है।
नाम क्या? तभी तो हमने आपसे बोला था, तभी अपने आपने कहा 8 बजे।
वहाँ पे जल्दी निकले तो 6 बजे से निकलेंगे। आपके भी काफी सारी बुक डाइवर्ट किए थे अकाउंटिंग
अच्छा हाँ, अकाउंटिंग
हाँ,
की।
तो वो कई सारी बुक ड्रॉप करके आज तो मेरी लीव में हैबिट करके आ रहा है।
चलिए तो
इस वजह से
चलो कुछ बैठे बैठे
Ladies and gentlemen, it's a moment of extreme pleasure to welcome you all. We have assembled here to celebrate Unani Day and International Conference on the theme Diet and Nutrition in Unani Medicine for Good Health and Well-Being. As we are all aware that Unani Day is celebrated every year on 11th of but This year, due to the sharp spike in COVID-19 cases in the month of February in UT of J&K, the event was postponed, so we are celebrating it today on 10th of March 2022. Ladies and gentlemen, our chief guest is arriving in a moment. Till then, please take your seats and put your cell phones on silent mode. Thank you. Ladies and gentlemen, our chief guest of the event, Sri Sarbanand Sonowal, Honorable Union Cabinet Minister, Ministry of Ports, Shipping and Waterways, and Ministry of Ayush has arrived with other eminent dignitaries. So let's welcome his arrival with a standing ovation. A very pleasant morning to everyone here. Okay, sir, I would like to request Dr. Mohan Singh to please grace our stage with your presence. Please, sir. Dr. Mohan Singh. So, big round of applause. A very pleasant morning to everyone over here. I am Dr. Said Samreena Ghilani. So I am profusely delighted to take an opportunity to welcome our dignitaries, Sri Sarbanand Sonowal, Honorable Union Cabinet Minister, Ministry of Ports, Shipping and Waterways, and Ministry of Ayush. Dr. Munjapara Mahindrabai Kalubai, Honorable Minister of State for Ayush and Minister of State for Women and Child Development. Shri Pramod Kumar Pathak, Special Secretary, Ministry of Ayush. Shri Vivek Bharadwaj, Additional Chief Secretary, Health and Medical Education Department, J&K. Shri Vedya Jayant Yashwandiyo Pujari, Chairperson, National Commission for Indian System of Medicine, New Delhi. Professor Talat Ahmad, Honorable Vice Chancellor, University of Kashmir, Srinagar. Professor Akbar Masood, Honorable Vice Chancellor Baba Ghulam Shah Badshah University, Rajouri, J&K. Professor Asim Ali Khan, DG CCRUM, Ministry of Ayush, Government of India. Dr. Mohan Singh, Director, Indian System of Medicine, J&K. And Dr. M.A. Qasmi, Advisor, Unani, Ministry of Ayush, Government of India. So my warm welcome and outright gratitude to our galaxy of distinguished guests. Now, ladies and gentlemen, I would request you all to please stand up in honor of National Anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगल दायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Thank you so much, everyone. Thank you. Now, to illuminate today's event, we will have lamp lighting ceremony and burning up isband, and for which I request honorable ministers and other dignitaries on the desk to do the honors. Please, sir. Thank you, sir. Thank you so much to all. Thank you. Thank you, sir. Thank you, sir. Thank you once again. Now, it's time to do the honors of presenting token of love and respect to all the dignitaries. So, I would like to request Professor Asim Ali Khan, DG CCRUM, to present bouquet and memento to chief guest of the event, Shri Sarbanand Sonowal, Honorable Union Cabinet Minister, Ministry of Ports, Shipping and Waterways, and Ministry of Ayush. Sir, please. So, big round of applause for the same. Thank you, sir. Now, sir, please present bouquet and memento to distinguished guest of honor, Dr. Munjapara Mahindrabai Kalubai, Honorable Minister of State for Ayush and Minister of State for Women and Child Development. Thank you so much, sir. Now, sir, please present bouquet and memento. Now, sir, please present bouquet and memento as a token of love to Sri Pramod Kumar Pathak, Special Secretary, Ministry of Ayush. So, put your hands together for the same. Thank you so much, sir. Sir, please present bouquet and memento to Sri Vivek Bharadwaj, Additional Chief Secretary, Health and Medical Education Department, Government of J&K. Big round of applause. Thank you, sir. Thank you so much. Now, I would like to request Dr. Seema Akbar, Assistant Director in charge Regional Research Institute of Unani Medicine, Srinagar, to do the honor in memento to Vedi Jayant Yeshwant Dio Pujari, Chairperson, National Commission for Indian Systems of Medicine, New Delhi. So, big round of applause. Now I would like to request ma'am to please present bouquet and memento as a token of love and respect to Professor Talat Ahmed, Honorable Vice Chancellor, University of Kashmir. So big round of applause for the same. Thank you. Now, I would request ma'am again to do the honors. Please present bouquet and memento as a token of love to Professor Akbar Masood, Honorable Vice Chancellor, Baba Ghulam Shah Badshah University, Rajouri, J&K. So put your hands together. Ma'am, please present bouquet and memento as a token of appreciation and gratitude to Professor Asim Ali Khan, DG CCRUM. So big round of applause. I would request ma'am again to do the honors of presenting bouquet and memento to Dr. Mohan Singh, Director, Indian System of Medicine, Ayush. Please put your hands together for the same. Thank you, ma'am. Now, I would request ma'am again to present bouquet and memento to Dr. M.A. Qasimi, Advisor, Unani Ministry of Ayush. So big round of applause. Thank you. Thank you so much to all. Ladies and gentlemen, we are extremely delighted to have you here with us on this special day when CCRUM Ministry of Ayush is celebrating Unani Day, an international conference on Unani medicine on the theme Diet and Nutrition in Unani Medicine for Good Health and Well-being. Ladies and gentlemen, we all are familiar that Unani Day is an annual event taking place every year on February 11th, which is the birthday of renowned Indian Unani physician Hakim Ajmal Khan, a versatile genius, a great scholar, a social reformer, a noted freedom fighter, a Unani medical educationist, and founder of scientific research in Unani system of medicine. In the last 7 years, the government of India has paid focused attention to the promotion of Ayush systems of medicine. Now, I would like to call upon DES Professor Asim Ali Khan, DG CCRUM, to welcome our distinguished guests and present his introductory remarks. Professor Asim Ali Khan, let's put hands together for the same.
Thank you. Assalamu alaikum, namaskar, and a very good morning. Very Honorable Shri Sarbananda Sonowal Sahib, the Honorable Minister of Ports, Shipping and Waterways and Ministry of Ayush, Very Honorable Dr. Munjpara Mahendra Bhai Khalu Bhai, Honorable Minister of State Ayush and Minister of State Women and Child Development, Shri Pramod Kumar Pathak Sahib, Special Secretary, Ministry of Ayush, Government of India, Shri Vivek Bharadwaj Sahib, Additional Chief Secretary, Health and Medical Education, Department, Government of Jammu and Kashmir, Union Territory of Jammu and Kashmir, Vaidya Jayant Yashwant Dev Pujari Sahib, the Chairman, National Commission for Indian Systems of Medicine, Professor Talat Ahmed Sahib, the Honorable Vice Chancellor of Kashmir University, Professor Akbar Masood Sahib, the Honorable Vice Chancellor of Baba Ghulam Shah Basha University, Dr. M.A. Kasmi Sahib, the Advisor Unani, Ministry of Ayush, Government of India, Dr. Mohan Singh, the Director, Indian System of Medicine, Government of Jammu and Kashmir, advisors from Ministry, Dr. Manoj Nesri Sahib, the Advisor Ayurveda, President Unani and Siddha Board, Dr. Jagannathan Sahib, Dr. M.C. Sharma Sahib, the Chairman, Scientific Committee of Pharmacopoeia Commission of Indian System of Medicine and Homeopathy, Vaidya Trigunaji, Devendra Trigunaji, a very learned Ayurveda scholar and a very renowned physician, Dr. Baswa Reddy ji, Dr. Zagar, Dr. Kabir Dar Sahib, Dr. Seema Akbar, the Director in charge, Deputy Director in charge of Regional Research Institute of Unani Medicine, CCRUM, Ministry of Ayush, Government of India at Srinagar, all the invited guests, experts, friends from media, dear students, ladies and gentlemen. I extend a warm welcome to all of you to the Unani Day celebrations, an international conference being organized by the Central Council for Research in Unani Medicine at Srinagar. Friends, Unani Day is an annual event of CCRUM. CCRUM is Central Council for Research in Unani Medicine, an autonomous body under the Ministry of Ayush, Government of India. It's for all stakeholders to come together and hold discussions on the excellent platform. This year, under the guidance of Ministry of Ayush, we are organizing a 2-day international conference in Srinagar, the valley famous for its mesmerizing beauty, where we have presence of esteemed experts from premier institutions across the country and many other parts of the globe. The theme of this international conference is Diet and Nutrition in Unani Medicine for Good Health and Well-being. We all know that diet is the basic source of energy. The normal growth and development and maintaining the health of the body is dependent upon healthy diet and its proper intake. Enhancing the body's natural defense system, that is immunity, is important in maintaining optimum health and preventing diseases. Unani system of medicine lays great emphasis on prevention of diseases and promotion of health through adopting principles of 6 essential factors. In Unani, we call them Asbab-e-Sitta Zaruriya for a healthy living. A well-balanced diet loaded with essential nutrients and proper dietary habits is advocated by health experts to strengthen the immunity. The Government of India, under the dynamic leadership of Honorable Prime Minister of India, Shri Narendra Modi Sahib, has been providing increasing patronage and funds for the multifaceted development of Unani system of medicine, as well as other Indian systems of medicine. As a result, Unani system of medicine, as we see today, forms an integral part of the national healthcare delivery system, and with pride we can say that we are the world leaders in Unani system of medicine. The Central Council for Research in Unani Medicine, CCRUM, is an apex body for formulation, coordination, development, and promotion of research scientific lines in Unani medicine. The Council, its research programs, obtained significant areas of clinical drug standardization, survey and cultivation plans, and literature. The drug standardization program of CCRUM has developed pharmacopoeia standards found in drugs for incorporation in the Unani pharmacopoeia. Besides, standard operating procedure for methods of preparation and pharmacopoeia standards are being developed. Under this program, CCRUM has developed pharmacopoeia standards 98 drugs and more than 2. Based on the outcome of research conducted by the Council, a number of patents have already been granted by the Indian. 7 out by research centers, campuses across the country, around 18, 19 states. And out of them, we are already 2 with us. And we are in the process of getting all our hospitals getting accredited by the NABH. We will be receiving the NABH accreditation certificate for RRIM Srinagar today in this function after some time, in the august presence of the honorable ministers and the dignitaries on the dais and your good self. Our other institutions, as I said, are in the process of getting these certifications and accreditations. We have a good manufacturing practice certified drug manufacturing unit at Hyderabad, and another one is coming up at Regional Research Institution of Unani Medicine at Chennai. In a move to strengthen research facilities at its institutions, the Council has upgraded laboratories at National Research Institution of Unani Medicine for skin disorders in Hyderabad, and RRIM Srinagar, Chennai, Aligarh, and DSRI Ghaziabad with state-of-the-art facilities and instrumentations, modern technology, and renewed infrastructure. The Department of Science and Technology, Government of India, has funded a project worth rupees 4.62 crores for strengthening the preclinical facilities at RRIM Srinagar. The drug testing laboratory at RRIM Chennai has also been approved by the State Drug Licensing Authority. We are providing services on outsourced basis for drug researches and animal studies to other research institutions in CCRUM's state-of-the-art developed laboratories at regional research institutions of Unani Medicine in Chennai and Srinagar, DSRI Ghaziabad, and our institution, National Institution in Hyderabad. Under the scheme of co-location centers, we call them Ayush co-location centers, in the leading allopathic tertiary care hospitals. The CCRUM has established Unani Medical Center at Dr. Ram Manohar Lohia Hospital, Unani Specialty Center at Dr. Deen Dayal Upadhyay Hospital, New Delhi, and Unani Medical Center at Safdarjung Hospital, New Delhi. The Ayush Wellness Clinic, established at the President's Estate, New Delhi, also has the facilities for Unani medicine, and we also have one Unani clinic at All Institute of Ayurveda, where all the sciences of traditional medicine have come together under one roof to provide the benefits to the people. CCRUM, having good infrastructure and expertise in Unani medicine, has established linkages with academic and scientific institutions of repute to work together and leverage their facilities and expertise for the advancement of traditional knowledge in scientific language and furtherance of other objectives of the Council. And for this purpose, the Council has collaborations and agreements with reputed institutions like Jawaharlal Nehru University, Jamia Millia Islamia, Jamia Hamdard, National Institution of Pharmaceutical Education and Research, Hyderabad, National Research Development Corporation, New Delhi, Invest India for Agni, that is accelerating growth of New India's innovations, New Delhi, Amity University, New Delhi, and many other reputed institutions of research and academic importance in the country. Besides, the Council has collaborations with a number of leading institutions for conducting researches under Expression of Interest scheme. The research publications related to Unani medicine are being updated periodically on the Ayush research portal. The CCRUM has so far published and uploaded almost 2,674 research papers on Ayush research portal. And that is accessible to all. We can watch this and we can take benefit out of it. Council is also engaged in academic activities and offer postgraduate, that is MD in Unani courses at National Research Institution of Unani Medicine for Skin Disorders, Hyderabad, and Regional Research Institute of Unani Medicine at Srinagar. The Survey of Medicinal Plants Unit, RRIUM Chennai, is involved in raw drug collection survey, that herbarium collection and collection of market samples of metal and mineral origin drugs from Karnataka, Andhra Pradesh, Andaman, Puducherry, Tamil Nadu, Telangana, for the development of regional raw drug repository that we call as Southern Plateau region. At international level, we have engaged in fruitful dialogue with countries like South Africa, Iran, China, USA, UK, Israel, Greece, Bangladesh, Sri Lanka, and certain other countries. An academic chair has been set up at the School of Natural Medicine, University of Western Cape, South Africa, where we had deputed a professor for 3 years to help in promoting and propagating Unani system of medicine. We have also signed an MOU with Hamdard University, Bangladesh, to set up an academic chair, and a professor is shortly joining the university there. An MOU between CCRUM and Tajik State Medical University, named after Avicenna, for cooperation in the field of traditional medicine was also signed in the presence of Honorable President of India, Shri Ramnath Kovind Sahib, and Honorable President of Tajikistan, Imamoli Ramon, in Dushanbe, Tajikistan. An MOM has also been signed with the Ministry of Health, Iran, for cooperation in the field of traditional medicine. CCRUM, through Ayush Virtual Convention Center, which is a popular virtual event platform of the Ministry of Ayush, also conducted a novel discussion series of e-Charcha, we called it, on various topics, which was streamed on various media platforms to reach out to the larger audience across the country and globe. CCRUM is also involved in various projects under the Ayush grid created by the Ministry of Ayush, implementation of HIMS, that we call as Ayush Hospital Management Information System, Namaste Portal, SROMET CT. SROMET CT is systematized nomenclature of medicine, clinical terms, are the various activities undertaken by the Council under the Ayush Grid project. The Ministry of Ayush, Government of India, has also undertaken several initiatives to harness the potential of Ayush systems of medicine to contain the impact of the COVID-19 pandemic. CCRUM had also played an active role by initiating many projects in this regard. 2 of them were population-based prophylactic studies, and the first ones were conducted on COVID-19 hotspot and quarantine areas through the Council centers in Lucknow, New Delhi, Mumbai, Aligarh, Srinagar, and Bengaluru, NIAM Bengaluru. The second study was also conducted in a population at high and moderate risk of COVID-19 patients. 2 more randomized controlled trials were carried out in COVID-dedicated hospitals to assess the safety and efficacy of Unani regimen in preventing the progression of severity of the diseases in hospitalized COVID-19 patients. We had also initiated 3 extramural research projects on clinical evaluation of the Unani formulation as add-on therapy in the management of COVID-19 patients. We also developed SOPs for preparation of pharmacopoeia standards for Ayush Joshanda. The efficacy of 4 Unani formulations against SARS-CoV-19 virus, namely Triaque Arba, Triaque Wabai, Arke Ajib, and 1 Unani novel drug was also established through in silico studies. Many research papers on COVID-19 were published by CCRUM related to clinical and other R&D initiatives and uploaded on National Repository on Ayush COVID-19. As a part of the Azadi Ka Amrit Mahotsav campaign launched by the Government of India to commemorate 75 years of our nation's freedom, Unani prophylactic medicines Khamira Marwarid and Unani Joshanda was also distributed to more than 1.4 lakh people across the country through 20 of the council centers across the country, along with dietary advices and lifestyle guidelines. The year-long campaign will continue till August 2022, when India celebrates 75 years and anniversary of the independence. We are thankful to the Government of India. I'm very thankful to the Honorable Prime Minister of India, Shri Narendra Modi Sahib, that after the establishment of as a separate Ministry of Ayush, leaps and bounds, we are moving forward as a ministry, and hundreds of new initiatives under the leadership of our honorable ministers, Shri Sarvananda Sonowal Sahib, the honorable minister, Shri Mahendra Bhai Sahib, our secretary, Rajesh Kotecha Sahib, our special secretary, Shri Pramod Kumar Pathak Sahib, and our leaders in Ayush system, in ministry. We are moving forward, and hundreds of new initiatives, not only in other systems, but in Unani system of medicine also, we are moving forward. Some of them I am going to quote in my talk. I am pleased to inform that Regional Research Center, Silchar, has been upgraded as a Regional Research Institute of Unani Medicine. In Silchar, Assam, we had a small center where 4 or 5 doctors used to work. Now a state-of-the-art huge facility has come of the cost of almost 50 crore rupees. And next month, probably we are going to have the building with us. Is a wonderful infrastructure which has been developed under the patronage of the Ministry of Ayush and the patronage of our honorable ministers. I am thankful to them. It is a wonderful facility, and very soon we are upgrading that facility as a regional research institution of Unani medicine in Silchar, Assam. Another regional research institute of Unani medicine, Mumbai, has been shifted to a newly constructed combined building of CCRUM and the Homeopathy Council at Kargar, Navi Mumbai. That is also an estimated cost of more than 30 crores rupees. That building we have occupied, and we have already shifted in that building. We have one more center there, that is in the JJ hospital. There is a tertiary care hospital in Mumbai. We are going to continue that hospital as well. RRIM Chennai is also upgraded with the establishment of Unani Pharmacy and Hammam block with an estimated cost of rupees 14.33 crore rupees. I am thankful to the Ministry of Ayush and Government of India for awarding a project amounting to more than 7 crore rupees under the Center of Excellence component of Ayush Swasth Yojana to the Regional Research Institution of Unani Medicine, Srinagar, for upgradation of facilities to the Center of Excellence in Regimenal Therapy, that is Ilaj bil Tadbir in Unani Medicine. On behalf of the Unani fraternity, I thank the Ministry of Ayush for providing financial assistance for the establishment of the Unani Medical College and Hospital in Kashmir under the centrally sponsored scheme to start the BUMS course in the first ever government medical college in government Unani Medical College and Hospital of Jammu and Kashmir at Nawab Bagh of Ganderbal district. That was inaugurated by our Honorable Minister of Ayush just recently. The National Institution of Unani Medicine in Bengaluru, we have a huge institution, a wonderful campus. An extension center of that, a satellite campus, is also being established with a 200-bed hospital facility at Ghaziabad. It's a very premier location at Ghaziabad. That building is almost ready, and hopefully within a month or two, we are going to have that building with us. That is for the higher education and research in Unani system of medicine, and the estimated cost of the building is 365 crore rupees, more than 360 crore rupees for establishment of that building. We constantly strive to outperform ourselves each year and set higher standards and benchmarks for us and those around us. I am grateful for the continued support and guidance of the Ministry of Ayush, which has helped us realize our objectives. This two-day international conference is a step in that direction. We have invited very eminent speakers and a robust panel discussion with selected panelists from different parts of the country who will enlighten us in this endeavor. Experts from UAE, Malaysia, Tajikistan, Bangladesh, Sri Lanka, South Africa, and Iran will also be sharing their experiences in the session on Unani medicine for global health. The conference will have sessions on diet and nutrition, an important component for the improving immunity and Unani medicine, lessons learned during pandemic, achieving good health and well-being, SDG 3, traditional systems of medicine for non-communicable diseases, and health and wellness. These lectures and during the seminar will be there. In today's conference, which is being organized in a hybrid mode, around 1,500 delegates have registered online, and we have around 600 delegates participating in physical mode. I am sure that the deliberations by the eminent speakers and the brainstorming of delegates and experts will lead to the incorporation of new ideas and unleash the positive energy which Ayush systems can bring in achieving the ultimate goal of a healthy society, not within the boundaries of our nation, but beyond the boundaries of our country across the globe. I once again welcome everyone to this wonderful conference and Unani Day celebrations. Thanking you very much. Jai Hind.
Thank you so much. Thank you so much. May I request Sri Vivek Bharadwaj, Additional Chief Secretary, Health and Medical Education Department, Government of J&K, to address the gathering. So big round of applause.
ये बहुत ही मुबारक मौका है, सिर्फ कश्मीर के लिए नहीं, पूरे देश के लिए, कि इंटरनेशनल यूनानी कॉन्फ्रेंस हमारे श्रीनगर में आज शुरू हो रही है। माननीय मंत्री आयुष श्री सर्वनाथ सोनवाल के कर कमलों से मंत्री जी का जो स्नेह और प्यार जम्मू कश्मीर को मिलता रहा है, उसका उदाहरण ये है कि पिछले 6 महीनों के अंदर ही ये दूसरी बार यहाँ पर आए हैं। पिछली बार जब आए थे तब हमें गांदरबल के यूनानी मेडिकल कॉलेज की सौगात दे गए थे, और इस बार जब आए हैं तब पूरे विश्व के लिए एक इंटरनेशनल कॉन्फ्रेंस का इंतज़ाम किया है। मैं एक और बात और एक और खुशखबरी भी आपके साथ साझा करना चाहता हूं कि 1-2 दिन पहले ही वर्ल्ड हेल्थ ऑर्गेनाइजेशन ने ये निर्णय लिया है कि पूरी दुनिया का ग्लोबल सेंटर फॉर ट्रेडिशनल मेडिसिन भारतवर्ष में होगा, जामनगर में होगा, और ये सब भी मंत्री जी के नेतृत्व में संभव हो पाया है। हम उनके बहुत बहुत शुक्रगुजार हैं। कई बार मुझे लगता है कि जैसे देश हमारा विविधताओं का देश है, खान पान की विविधता है, अलग अलग तरह के लोग कपड़े पहनते हैं। इस समय हम सब सर्दी मना रहे हैं तो चेन्नई में लोग गर्मी से त्रस्त हैं, लेकिन सब उसके बावजूद भारतीय हैं, एक साथ हैं। इसी तरह शायद हमारा ट्रेडिशनल सिस्टम ऑफ मेडिसिन आयुष भी है। अलग अलग तरह की सिस्टम्स हैं, अलग अलग तरह की जड़ी बूटियां हैं, उसके बावजूद ये नहीं कि एक बड़ा है, एक छोटा है, एक कम है, एक ज़्यादा है। सरकार सभी को प्रोत्साहन देती है, सभी के लिए काम करती है। और आप देखिए कि कई दशकों तक यूनानी डे नाम की भी चीज नहीं थी। ये तो 5 साल पहले ही हकीम अजमल खान साहब के जन्मदिन पर घोषणा करी गई कि भारतवर्ष में यूनानी डे उनके जन्मदिन पर होगा। तो सरकार बहुत कुछ कर रही है। अब ये समय है कि हमें भी इन सब सुख सुविधाओं का लाभ उठाना चाहिए। हमें भी कंधे से कंधा मिलाकर सरकार के साथ आगे बढ़ना चाहिए। मैं आशा करता हूं कि ये जो कॉन्फ्रेंस है ये एक मील का पत्थर साबित होगी, कश्मीर के लिए भी, भारतवर्ष के लिए भी। मेरी बहुत बहुत शुभकामनाएं। धन्यवाद।
Thank you so much, sir. Now I feel extremely privileged to invite on this Professor Akbar Masood, Honorable Vice Chancellor, Baba Ghulam Shah Badshah University, Rajouri, J&K, to have his precious input. So big round of applause for Professor Akbar Masood Saab.
श्री सर्बानंदा सोनवाल साहब, श्री मुंजपारा महेंद्र भाई कालू भाई साहब, श्री प्रमोद कुमार पाठक साहब, प्रोफेसर तलल अहमद, श्री वैद्या जयंत यशवंत देव पुजारी साहब, श्री पांडियन साहब, श्री M.A. कासमी साहब, प्रोफेसर आसिम अली खान साहब, श्री मोहन सिंह जी, dignitaries of the dais, my friends, Dr. Seema and other attendees. Assalamu alaikum, adab, a very good morning. Friends, about 40 years back, CCRUM took a decision to establish a regional research institute of Unani medicine at Kashmir. Since it was a research institute, it was established in Kashmir University. Kashmir University also accepted the proposal because this was an academic activity. Initially, it started from 2-3 barracks, wooden barracks. I have been associated with this institute for about 25 years officially. First as advisor biochemistry to the institute, later on dean of the faculty, and then dean academic affairs. So I have seen the growth of the institute. So from 2-3 barracks, now the institute is a full-fledged world-class institution. Again, the Kashmir University has extended a very fruitful support to the establishment of this institute. Reciprocally, the institute has also contributed equally in the development of science and technology in Kashmir University. The institute established collaborations with almost all the science departments in the university. They have produced about 25 MPhil and PhD degrees under collaboration. Now, the institute is a world-class institute, and take my words that you won't find a better institution in Unani sector in the entire northern India. World-class facilities. Now, to have world-class facilities is not a very difficult thing. But the important thing is how to utilize those facilities appropriately. So, ladies and gentlemen, the institute has so far produced more than 200 research papers under collaborative studies. Most of the papers, they are in impacted journals. The researchers of the institute, they have their own citation index, they have their own H factors, and I'm happy to say that the institute itself has a citation, this H factor, which is very rare in. So I wish best of luck to the institute for its further growth. I'm sure that the institute will grow further under the dynamic leadership of its director, Professor Asim Ali Khan, and the Honorable Minister and the Honorable Prime Minister. I wish good luck to the organizers for this international conference. There are many people in line, so I won't take much. So thank you very much. Thank you very much.
Thank you so much, sir. Now, I am extremely overwhelmed to invite Professor Talat Ahmad, Honorable Vice Chancellor, University of Kashmir, Srinagar, J&K, to come on dais for his address. So, big round of applause for Professor Talat Ahmad.
बहुत बहुत शुक्रिया जनाब सोनावाल साहब, ऑनरेबल मिनिस्टर पोस्ट शिपिंग एंड वाटरवेज, मिनिस्टर ऑफ आयुष, जनाब कालू भाई जी, ऑनरेबल मिनिस्टर फॉर आयुष एंड मिनिस्टर ऑफ स्टेट फॉर वुमेन एंड चाइल्ड डेवलपमेंट, श्री प्रमोद पाठक जी, श्री विवेक भारद्वाज जी, श्री देव पुजारी जी, डॉक्टर प्रोफेसर अकबर मसूद साहब, डॉक्टर मोहन सिंह साहब, डॉक्टर कासमी साहब, डॉक्टर सीमा, my other colleagues, friends from different institutions in Kashmir, and all my participants here, Assalamu alaikum and good morning. जैसा कि अभी अकबर मसूद साहब ने बताया कि यहाँ की जो रीजनल रिसर्च इंस्टीट्यूट है वो हमारे कश्मीर यूनिवर्सिटी के साथ है और काफ़ी अच्छा यहाँ पे काम चल रहा है। तो ख़ास करके आप देख सकते हैं कि ये इतना बड़ा कॉन्फ्रेंस जो है वो आयुष का यहाँ पे किया जा रहा है। उसके लिए मैं ख़ास करके मुबारकबाद दूंगा डॉक्टर सीमा और उनके सारे साथियों को जो यहाँ पे हैं, कश्मीर में ख़ास करके ये काम कर रहे हैं। आपको शायद पता होगा, कम से कम आसिम अली साहब जानते हैं कि जब मैं जामिया का वाइस चांसलर था, जामिया में हकीम अजमल खां का बहुत बड़ा रोल रहा है शुरू से, बट टू माई सरप्राइज वहाँ पे उनके नाम से कोई इंस्टीट्यूशन नहीं थी, कोई सेंटर नहीं था। तो मैंने उस वक्त जो थे हमारे आयुष के ही पाठक साहब जो और आसिम अली खान साहब, इन लोगों से मिलकर मैंने वहाँ पे एक सेंटर खोला था हकीम अजमल खां के नाम से, और अब वहाँ पे रिसर्च भी होने लगी थी जब तक मैं वहाँ था, और टीचिंग भी चल रही थी। तो ये बहुत ही इम्पोर्टेंट मैं समझता हूँ कंट्रीब्यूशन है कि दिल्ली में रह के अगर उस यूनिवर्सिटी जिसमें कि हकीम अजमल खान ने इतना कंट्रीब्यूट किया, उसे उस वक्त तक नहीं मान्यता मिली थी। और ख़ास करके कश्मीर में जब मैं देखता हूँ तो मुझे बहुत अच्छा लगता है कि यहाँ पे जो है आयुष ने बहुत सारी फैसिलिटीज़, अब ख़ास करके अभी एक नया और गांधरबल में जो हम एक मेडिकल कॉलेज खोल रहे हैं, तो मुझे पूरी उम्मीद है कि ये ट्रेडिशनल मेडिसिन जो कि हिंदुस्तान में, अब जैसे अभी अभी जस्ट भरद्वाज साहब बता रहे थे कि ये इंटरनेशनल सेंटर जिसको रिकॉग्नाइज किया गया है वो गुजरात में कर रहे हैं, तो इस तरह की डेवलपमेंट बहुत अच्छी है। और उसके लिए मैं मुबारकबाद देता हूँ हमारे प्रधानमंत्री जी को, नरेंद्र मोदी साहब को, और ख़ास करके सोनवाल साहब और कालू भाई जी को, जिनके लीडरशिप में इस तरह की चीज़ें अब हो रही हैं। मैं मुबारकबाद देता हूँ हमारे जो रीजनल सेंटर है यहाँ पे, ये 2 दिन के बड़े कॉन्फ्रेंस करने का, ख़ास करके इंटरनेशनल कॉन्फ्रेंस करने का, और जाहिर है इसका फ़ायदा सिर्फ कश्मीर को नहीं बल्कि सारे हिंदुस्तान को और सारे दुनिया में इसके बारे में लोगों को पता चलेगा कि कश्मीर में भी बहुत सारी ट्रेडिशनल मेडिसिन्स हैं जिनका जिक्र होगा और उसका बहुत बहुत फ़ायदा होगा। मैं बहुत मुबारकबाद अब सबको देता हूँ, और ख़ास करके मैं शुक्रिया अदा करता हूँ हमारे मंत्री जी का, सोनवाल साहब और कालू भाई जी का, कि आप यहाँ तशरीफ़ लाए और आपने कश्मीर को बराबर अपने नज़र के करीब रखा। बहुत बहुत शुक्रिया।
Thank you so much, sir. Thank you. Ladies and gentlemen, Unani system is a science of health and healing which aims to assist people in living a healthy life. It provides knowledge of how to live a longer and healthier life. Our traditional system of medicine have got a boost under the excellent leadership of our Honorable Prime Minister, Shri Narendra Modi ji. Now, I am extremely delighted to take the opportunity to invite on this Shri Vedya Jayant Yashwantiyo Pujari, Chairperson, National Commission for Indian Systems of Medicine, New Delhi, to address the gathering. So, big round of applause, please.
सभी को मेरा नमस्कार। मंच पर विराजमान परमादरणीय मंत्री महोदय श्री सर्वानंद सोनोवाल जी, समादरणीय डॉक्टर मुंजपारा महेंद्र भाई कालू भाई जी, यहाँ पर उपस्थित हमारे मिनिस्ट्री के स्पेशल सेक्रेटरी श्री प्रमोद कुमार पाठक जी, एडिशनल चीफ सेक्रेटरी हेल्थ एंड मेडिकल एजुकेशन डिपार्टमेंट गवर्नमेंट ऑफ जम्मू एंड कश्मीर श्री विवेक भारद्वाज जी, यहाँ पर उपस्थित दोनों यूनिवर्सिटीज़ के परमादरणीय वाइस चांसलर्स प्रोफेसर अकबर मसूद जी और प्रोफेसर तलत अहमद जी, यहाँ पर उपस्थित यूनानी और सिद्धा बोर्ड के प्रेसिडेंट के जगन्नाथन जी, इसी सभागार में उपस्थित हमारे परमादरणीय वैद्य देवेंद्र त्रिगुणा जी, डॉक्टर मनोज नेसरी जी, प्रोफेसर आसिम अली खान जी, डॉक्टर बसवा रेड्डी जी, हमारे आसिम अली खान साहब की लोकल टीम, डॉक्टर सीमा और उनके सहयोगी, सभी को मेरा नमस्कार और सभी को मेरा बहुत बहुत धन्यवाद कि आपने मुझे एक मौका दिया यहाँ आने के लिए और मुझे मेरे 2 शब्द रखने के लिए। सर्वप्रथम यूनानी डे की सबको आपको हार्दिक अभिनंदन। हम यहाँ पर आज भले ही देरी से जमा हो गए, लेकिन यूनानी डे तो सेलिब्रेट होना ही चाहिए, क्योंकि जिस शख्स के नाम से ये यूनानी डे मनाया जाता है, उसकी जो ऊंचाई है, वो शख्स की ऊंचाई है, उसको हमने वैसे तो रोज़ ही याद करना चाहिए, लेकिन कम से कम साल में एक बार तो याद करना ही करना चाहिए। तो इसलिए ये यूनानी डे का जो सेलिब्रेशन है, उस महान व्यक्ति को याद करने के लिए है, जिसकी दरअसल हमने रोज़ याद करनी चाहिए। यूनानी सिस्टम ऑफ मेडिसिन का विशेष रूप से रिसर्च में जो भी डेवलपमेंट हो रहा है आसिम अली खान सर के नेतृत्व में, उसके बारे में आपने सबने अभी सुन लिया कुछ समय पहले। मैं आपको बताना चाहता हूं कि यूनानी एजुकेशन के बारे में भी काफ़ी सारी इनिशिएटिव्स जो है वह नेशनल कमीशन फॉर इंडियन सिस्टम ऑफ मेडिसिन ने ली है, और उसके जो अध्यक्ष है के जगन्नाथन सर, वो यहाँ पर उपस्थित है। आप लोगों ने अभी जो नया यूनानी का MSc मिनिमम स्टैंडर्ड ऑफ एजुकेशन आया है वो आपने देखा होगा, और जिस प्रकार से उसकी रचना की गई है उसके बारे में भी आप लोग बहुत अच्छी तरह जानते होंगे, ऐसा मैं समझता हूँ। मेरी सबसे यहाँ पर विद्यार्थियों से, अध्यापकों से, रिसर्चर्स और जो भी यहाँ पर स्टॉलवर्ड्स यूनानी के बैठे हैं उनसे मेरा विनम्र निवेदन है कि वो थोड़ा समय निकाल कर उसे पढ़ें। इसका कारण ऐसा है कि यूनानी का जो एजुकेशन का ट्रेनिंग है, हम चाहते हैं कि वह स्किल डेवलपमेंट में ज़्यादा ध्यान रखे, और हमारे जो यूनानी के ग्रेजुएट्स बाहर आते हैं, हमारे जो यूनानी के पोस्ट ग्रेजुएट्स बाहर आते हैं, उनका जो क्लिनिकल लेवल है वो अभी जो है उससे 1 कदम और 2 कदम और बढ़े, और इसलिए उसकी रचना की गई है। इतना ही नहीं तो हमारे यूनानी के जो ग्रेजुएट्स हैं वह इस नए ज़माने के लिए तैयार हो, इसलिए ये जितने भी आयुर्वेद, यूनानी और सिद्ध के MSc अभी बाहर आ गए हैं, इन सबका टारगेट 2030 है। ये आपने ध्यान में रखना चाहिए। कई चीज़ें ऐसा लगता है वो पढ़कर कि ये इतने जल्दी क्यों लाया गया है। तो ये शुरू ही इस साल जो एडमिशन हुई है उससे होने वाला है, और ये लड़के 5.5 साल बाद ग्रेजुएट होंगे, उसके बाद 3 साल के बाद में वो लोग पोस्ट ग्रेजुएट होंगे। करीब करीब 2030 का समय आ जाता है जब ये हमारे जो विद्यार्थी है जो पूरे ग्रेजुएट बनकर और समाज की सेवा करने के लिए, देश की सेवा करने के लिए मैदान में उतरेंगे। तो उसको टारगेट करते हुए यह MSc को तैयार किया गया है। इसमें और एक चीज़ मैं आपको बता देना चाहता हूं कि उर्दू का एंट्री लेवल पर जो एक हर्डल था उसके बारे में हमको रिप्रेजेंटेशन मिला था कॉलेजेस की ओर से, ऑर्गेनाइजेशंस की ओर से, और उसका अध्ययन करने के बाद हमको ऐसा लगा कि इसको भी खोलना चाहिए। लेकिन उर्दू का महत्व यूनानी में कभी कम नहीं हो सकता। जैसे संस्कृत का महत्व आयुर्वेद में कम नहीं हो सकता, तमिल का महत्व सिद्धा में कम नहीं हो सकता, वैसे ही उर्दू का महत्व यूनानी में कभी कम नहीं हो सकता। तो इसको एड्रेस करने के लिए हम लोगों ने कुल जो पहले आपने देखा होगा कि पुराने MSc में अरेबिक और बेसिक इसके लिए सिर्फ 100 घंटे की पढ़ाई दी गई थी। अभी 100 घंटे की पढ़ाई में न तो उसको ठीक से अरेबिक आता था, न वो अच्छे से यूनानी के बेसिक प्रिंसिपल समझता था। इसलिए ये समय बढ़ाकर हम लोगों ने 270 आवर का कर दिया है, यानी डबल से ज़्यादा कर दिया है। और उसके साथ साथ उर्दू को भी जोड़ा गया है उसके साथ में। ये जो अरेबिक पढ़ाने वाले टीचर थे वो पार्ट टाइम रहा करते थे। अभी हम लोगों ने ये सोचा, उसमें अध्ययन किया, एक्सपर्ट्स को बुलाया, और उसमें ध्यान में आया कि ये पार्ट टाइम पढ़ाने वाला विषय है नहीं, इसको तो फुल टाइम शिक्षक चाहिए। इसलिए अरेबिक के शिक्षक को हमने फुल टाइम शिक्षक के रूप में अभी हर कॉलेज में रखने के लिए कहा गया है। सिर्फ इतनी ही चीज़ है कि हमारे आप सब जानते हैं, आप सब पढ़े लिखे भी हैं और उम्रदराज भी हैं, बच्चे तो है नहीं यहाँ पर कोई। तो हर माँ बाप की ये इच्छा रहती है कि मेरे बच्चे को मैं सबसे अच्छी तालीम दूँ, और स्कूल की समय से ही ये अच्छी तालीम के लिए जो भी उपलब्ध सुविधा वहाँ रहती है, कभी CBSE के नाम पे रहती है, कभी स्टेट गवर्नमेंट की स्कूल्स के नाम से रहती है, तो उसमें हो सकता है कई बार कि उर्दू मीडियम न हो और वो बच्चा पहले से उर्दू न पढ़ता हो। तो ऐसे जो विद्यार्थी थे वो नीट के थ्रू यूनानी में या BUMS में आ ही नहीं सकते थे। तो इस हर्डल को हमने दूर कर दिया है। अभी जो भी लड़का है नीट पास करेगा वो यहाँ एंट्री लेवल पर तो वो BUMS में एडमिशन ले सकेगा। हाँ, जैसे विद्यार्थी संस्कृत का अध्ययन करता है वैसे वो उर्दू और अरेबिक का अध्ययन करेगा और आगे चलेगा। तो इस प्रकार के कुछ बदलाव जो है वह हम लोगों ने एजुकेशन में लाए हैं। आज जिस प्रकार से दुनिया बढ़ रही है, दुनिया का डेवलपमेंट हो रहा है, साइंस एंड टेक्नोलॉजी का डेवलपमेंट हो रहा है, उसको देखते हुए हमारा जो यूनानी का विद्यार्थी है वो उसमें भी रुचि जो रखता है। कल जाके किसी यूनानी के विद्यार्थी को ऐसे लगा कि मुझे ये समझना है कि रोबोटिक सर्जरी क्या है, हम लोगों ने उसके लिए इलेक्टिव्स का प्रोविज़न करके रखा है। वो ऑनलाइन कोर्स करेगा, उसकी जानकारी लेगा, उसका ऑनलाइन सर्टिफिकेट भी निकलेगा। तो उसके पास उसने इसका अध्ययन किया है, इसका वो सिर्फ सिलेबस में नहीं रहेगा, उसके पास उसका अलग से सर्टिफिकेट भी रहेगा। और जो भी हमारा यूनानी का विद्यार्थी ऐसे इस प्रकार के कई विषयों में वो आगे जाना चाहता है, कई विषयों की वो जानकारी लेना चाहता है, नई दुनिया की जानकारी लेना चाहता है, उसकी भी व्यवस्था ये इलेक्टिव्स के जरिए हम लोगों ने की है। और एक चीज़ हम लोगों ने उसमें की है तीनों एमएससी में, कि हमारे एक्ट में लिखा है कि सप्लीमेंटेड बाय मॉडर्न साइंस एंड टेक्नोलॉजी। तो यूनानी का सप्लीमेंटेशन मॉडर्न साइंस एंड टेक्नोलॉजी में कैसे होगा, इसकी जो मेथोडोलॉजी है वो हमने लिखी है। ये जो प्रोविजन थी वो पिछले भी एक्ट में थी, 1970 वाली भी एक्ट में थी, लेकिन उसकी मेथोडोलॉजी मालूम नहीं होने से इसकी कोई सिस्टम हमारी आखिरी तक बैठ नहीं पाई थी कि ये मॉडर्न साइंस एंड टेक्नोलॉजी का मतलब क्या है। कई बार ये होता था कि एलोपैथी को जोड़ना यही उसका, ये उसका मतलब नहीं है, ये उसका कतई मतलब नहीं है। लेकिन हम लोग हमारे जो जितनी भी सिस्टम्स है उसको हम मॉडर्न साइंस एंड टेक्नोलॉजी से दूर नहीं रख सकते। हम वो जो टेक्नोलॉजी को है हम लोग अंदर लाना चाहते हैं हमारे, तो उसकी जो सिस्टम है वो कैसी होगी, इसका भी डेफिनेशन हम लोगों ने ये एमएससी में बहुत अच्छे से किया है, जो यूनानी को स्ट्रेंथन करेगा। तो इसलिए इस प्रकार के जितने भी इनिशिएटिव्स हैं, मेरा आपसे नम्र निवेदन है कि उसके थ्रू आप जाइए। आपके जो सुझाव है, हमारे जगन्नाथन सर बड़े ही ओपन माइंडेड है, वो तो तुरंत उस व्यक्ति को बुला के उससे डिस्कस करके उसको समझ लेते हैं कि समस्या क्या है या उनका कहना क्या है, और जो अपना कहना है वो रखते हैं। तो फिर से एक बार मैं आपको इस यूनानी डे के बारे में मुबारकबाद देना चाहता हूँ और आपसे विदा लेता हूँ। नमस्कार और धन्यवाद।
Thank you so much, sir. Now I consider it as a great honor to invite guest of honor, Shri Pramod Kumar Pathak ji, Special Secretary, Ministry of Ayush, for his address. So big round of applause for Shri Pramod Kumar Pathak ji, please.
Honorable Sri Sarvanand Sonowal ji, Union Cabinet Minister, Ministry of Ayush and Ministry of Port, Shipping and Waterways, who has brought new energy, enthusiasm and guidance to Ministry of Ayush since he took over. Dr. Munjapara Mahendra Kalu Bhai, Honorable MOS Ayush and MOS Women and Child Development, who has always encouraged us to take common man by his own example. Padma Shri and Padma Bhushan Vaidraj Sri Devendra Triguna ji, Vaid Jain Dev Yashwant Dev Pujari ji, Professor Asim Ali Khan ji, Sri Jagannathan, President Board of Unani Siddha, NCISM, Professor Talat Ahmad, Professor Akbar Masood, Vaidya Manoj Nesri ji, Sri Baswa Reddy ji, distinguished participants of the dais, esteemed speakers, friends from media, ladies and gentlemen. First of all, I extend my heartfelt congratulations on the occasion of Unani Day, which is being held today in the beautiful surroundings of Srinagar. It is a matter of great pleasure for me to address this august gathering in the inaugural session of the Unani Day 2022, an international conference on Unani medicine organized by the Central Council for Research in Unani Medicine at Srinagar. Jammu and Kashmir has a significant footfall of stakeholders of Unani medicine. It is heartening to see that delegates from all over the country, renowned experts and stakeholders from reputed academic, research and health organizations have joined us today through both physical and virtual mode. The theme of conference, Diet and Nutrition in Unani Medicine for Good Health and Well-being, is very apt and well thought out, as proper diet and nutrition are key to good health and well-being. There is a need to create awareness in the community about our traditional dietary practices, which help in building immunity and prevention of many disease conditions. Unani medicine has a holistic approach to adjust the imbalances which contribute to disease. It is aimed at treating body, mind, and soul. Diet forms an essential component of Unani therapies prescribed for the prevention as well as treatment of diseases. The choice of food and the manner in which food is prepared both are vital for strengthening of health with different treatment strategies. CCRUM is the apex organization for research and development in Unani medicine, and it is doing very commendable job under the able leadership of Professor Asim Ali Khan. It is indeed heartening to see that the CCRUM has obtained significant leads in clinical research, drug standardization, survey and cultivation of medicinal plants, and literary research. Besides research-oriented health services, public health initiatives, information, education, and communication activities are also being undertaken. I am also happy to note that CCRUM has initiated collaboration with various leading national and international scientific institutions. The Ministry of Ayush had issued various guidelines and advisory to improve immunity and advise simple home remedies easily accessible to the general public for preventive health measures, with a special reference to respiratory health and enhancing immunity for the management and medication of COVID. Apart from guidelines and advisory, the ministry had also launched campaigns such as Ayush for Immunity to disseminate the health promotion messages in the general public and set up an Ayush COVID-19 dashboard to furnish the details of guidelines related to Ayush measures for improving immunity, official communications, research undertaken on COVID-19 measures for prophylaxis and management. Research councils and national institutes were actively involved in various research activities related to COVID-19. CCRUM carried out several COVID-19 related research projects, initiating clinical studies on different Unani regimens as prophylactic and add-on intervention to study the impact of Unani medicine in high-risk population. Quarantine and hospitalized SARS-CoV-2 tested positive, asymptomatic, mild to moderate symptoms COVID-19 cases. The results of these studies were encouraging and positive leads were obtained, which are being followed up. For the benefit of people of Jammu and Kashmir, a state-of-art laboratory has been established at Regional Research Institute of Unani Medicine at a total cost of around 5 crores, out of which around 3 crores was provided by Department of Science and Technology. The ministry has also approved a project amounting to Rs 7 crores under Center of Excellence component of Ayush Swasth Yojana at RRIUM Srinagar for upgradation of facilities to Center of Excellence in Ilajit Tadbir Regimental Therapy. The Government Unani Medical College and hospitals at Gandarbal, Kashmir has been constructed with the financial assistance from Ministry of Ayush, which has been provided under National Ayush Mission. I would say that Government of India is giving a focused attention to the development of traditional system of medicine in India under the able guidance and direction of our Honorable Prime Minister. The policies have been designed for multifaceted development of Ayush system of including Unani system of medicine. I am happy to say that Today, India has the widest network of educational, research, healthcare, and pharmaceutical institutions of Unani medicine and enjoys the position of world leaders in this area. I must appreciate the efforts put in by the officers of CCRUM under the able guidance of Professor Asim Ali Khan. I am also happy to see that the conference has provided a purposeful platform for all the participants from across the country to share their valuable work, which will contribute for further developments of Unani system of medicine. I also take this opportunity to thank Dr. Seema Akbar, Director RRIUM, and her team for successfully organizing this conference. I wish all the participants excellence in their future endeavors. Thank you. Jai Hind.
Thank you so much, sir. We are sure that under the leadership of our Honorable Prime Minister, Unani medicine will keep making progress. Maintaining the integrity of nature and human health is a big challenge in today's scenario. At this complex juncture, human beings are struggling to overcome these odds for survival. So Unani system of medicine play a vital role due to its holistic approach, safety, efficacy, easy availability, and cost effectiveness. Now, I am profoundly delighted to take this opportunity to invite Dr. Munjapara Mahendrabai Kalubai, Honorable Minister of Ayush and Minister of State, Women and Child Development on days for his valuable insights. So big round of applause.
Sri Sarvanand Sonowal ji, Honorable Cabinet Minister of Ports, Shipping, Waterways, and Minister of Ayush. Sri Pramod Kumar Pathak ji, Special Secretary, Ministry of Ayush. Professor Talat Ahmed, Vice Chancellor, University of Kashmir, Srinagar, Jammu and Kashmir. Professor Akbar Masood, Vice Chancellor, Baba Ghulam Shah Badshah University, Rajouri, Jammu and Kashmir. Sri Vivek Bhardwaj, Additional Chief Secretary, Health and Medical Education Department, Government of J&K. Vaidya Jayant Yashwant Dev Pujari ji, Chairperson, National Commission for Indian System of Medicine, New Delhi. Dr. M.A. Kasmi, Advisory, Unani. Dr. Mohan Singh, Director Ayush, Jammu and Kashmir. Sri Triguna ji, Nesri ji, Basavada ji, international and national delegates, distinguished guests, friends from media, लेडीज एंड जेंटलमैन, सबसे पहले तो गुड मॉर्निंग। और मेरे पास आयुष मिनिस्ट्री तो है, साथ में दूसरा वुमेन एंड चाइल्ड WCD मिनिस्ट्री भी मेरे पास। और अभी अभी हमने इंटरनेशनल वुमेन वीक 1 मार्च to 8 मार्च सेलिब्रेट किया। और आज भी, क्योंकि मैं भी आपकी बिरादरी का हूँ, मैं भी डॉक्टर हूँ, और यहाँ काफ़ी महिलाएं, लेडी लोग जो यूनानी के साथ जुड़े हुए वो दिखाई दिए, तो मुझे उससे बहुत ही आनंद हो रहा है। ये सुन के हमारा सोनोवाल जी ऐसा बोला कि साहब ने 50% वोट तो खींच लिया। It gives me immense pleasure to be part of Unani Day 2022 and inaugural function of International Conference on Diet and Nutrition in Unani Medicine for Good Health and Well-being. I am told that Unani Day is observed on birthday of revered freedom fighter Hakim Ajmal Khan, a great Unani physician, educationist and philanthropist. I take this opportunity to pay my tribute to Hakim Ajmal Khan. I also congratulate Central Council for Research in Unani Medicine for rightly organizing this year's Unani Day celebration in Kashmir, which has nurtured Unani medicine for centuries. The theme for conference is Diet and Nutrition in Unani Medicine for Good Health and Well-being. Ensure awareness and awakening to the role diet and nutrition play maintaining good health and well-being. Health is subject that concern not only the health professional but each one of us. Health is viewed holistically as an interacting system with mental, emotional and physical components. The WHO defines health as a state of complete physical, mental and social well-being and not merely the absence of disease or infirmity. A holistic approach to health requires universal and affordable access to healthcare. It also calls a renewed focus on mental health issue. Health, health and well-being are closely linked with the diet we take. India possesses a rich heritage of traditional system of medicine which have been playing an important role in providing holistic healthcare to the masses. Each of the Ayush system, namely Ayurveda, Yoga and Naturopathy, Unani, Siddha, Swaripa and Homeopathy are unified on this concept of holistic treatment. These systems are meant to enhance the total health of human being, both mental and physical, which are essential in pursuit of health, happiness and long life. Unani medicine is unique as it has been nurtured by best of intellect of many cultures during past many centuries and hence it pertinently has been playing a vital role in present day healthcare delivery system. This integration of Unani medicine Ayush system in mainstream healthcare is based on prior acceptability of the system in the public. The significant features of Ayush system are accessibility, affordability, and holistic approach towards healthy living. The drugs used in this system are mainly obtained from plants, so they are comparatively safer. This system offers time-tested remedies for various common and chronic ailments. Unani system of medicine, along with other Ayush system, played an important role in finding solutions for various health challenges like malaria, hypertension, etc. These systems having helped us in fighting against COVID-19 as well. While acknowledging the time-tested efficacy of our traditional system of medicine, it is equally important to progress and evolve with the changing time, adapt to new technique of health research and contribute a new approach in health management. Scientific validation of our age-old therapies is important for greater acceptance and globalization. I believe that collaboration with scientists from varied streams like biochemistry, biogenetics, bioinformatics and nanotechnology is need of our for bringing out the yet unknown potential of Unani medicines. Diet is very important aspect of life as it is the basic source of energy. The normal growth and development of body are depend upon a healthy diet and its proper intake. I have been told that Unani medicine provides detailed guidelines laid down for healthy food habits to maintain health and prevent various diseases and disorders. It is known fact that judicious selection and intake of proper diet ensures good health while errant practice may lead to different disease. Selection of food should be based upon the health status, age, build, lifestyle and other relevant factors of an individual. However, increased production of processed food, rapid urbanization and changing lifestyle have led to shift in dietary patterns. People are now consuming more food high in energy, fats, free sugars and salt sodium and many people do not eat enough fruit, vegetable and other dietary fiber such as whole grain which is a cause of concern and that forms the basis of diseases. I am told each food item has nature of its own, hence food compatible to the health condition of an individual and fulfilling his her need should be selected. Like drugs, every food item has particular type of temperament. As food items produce changes in body according to their temperament. Therefore, certain types of food which may be suitable for particular temperament of an individual or in a particular condition may not suitable for opposite temperament. Immunity enhancement is yet another strong point of Ayush system and diet plays an important role in this. Diet assists patients in their recovery process and improves the quality of life of the patient suffering from chronic disorders. I appreciate the activity role played by CCRUM along with other organizations under Ministry of Ayush during the COVID-19 pandemic in creating awareness in community regarding enhancements of immunity, advertising preventive measures, providing prophylactic drugs, and undertaking several COVID-19 related research projects. This multifaceted approach of Ayush system had significantly contributed in combating the pandemic. It is indeed heartening to see that CCRUM, which is an apex organization, has obtained significant leads in clinical research, drug standardization, survey and cultivation of medicinal plants and literary research during the past 4 decades of its existence. Besides, research organization, health service, public health initiative and information, education and communication activities are also being undertaken, winning the appreciation from various quarters for research outcomes. I am happy to note that the Council, having realized the importance of collaborative research for promotion and development of Unani medicine, has entered into collaboration with various leading scientific institutions. Before concluding, I would like to say a word of encouragement for young students and researchers who are present here today and those who are attending the deliberation of the conference in a virtual mode. This conference is perfect opportunity for you to learn from the knowledge and experience of the renowned experts and broaden your vision and horizon to progress in the field. Such platform bring together people with different form of ideas and expertise and brainstorm for future roadmap. I am sure that deliberation during the conference will help in further utilization of the strength of Unani medicine in mainstream healthcare and will make us future ready. I wish the conference a great success. Jai Hind. Thank you.
Thank you so much, sir. Ladies and gentlemen, Moraji Desai National Institute of Yoga organized a training program for yoga instructors under National Ayush Mission. Around 225 yoga instructors have successfully completed wellness instructor course and also successfully got YCB certifications. So to distribute the YCB certificates in the presence of honorable ministers and dignitaries, may I call on stage Dr. I.V. Baswareddy, Director MD NIY, to join the dignitaries on the dais to felicitate the yoga instructors. Please, sir. So big round of applause. Sir, please. Thank you. Now I would like to request Honorable Union Cabinet Minister Shri Sarbanand Sonowal to do the honors of presenting certificates. Yoga instructors of Ayush Health and Wellness Centers of J&K working under the Directorate of Ayush J&K who are going to receive the certificates today. So I would like to call upon stage Mir Mehreen from District Pulwama. So big round of applause, please. From District Pulwama.
नमस्कार, मैं डॉक्टर मोनिका गुप्ता, डायरेक्टरेट ऑफ आयुष J&K की ओर से आप सबका स्वागत करती हूँ। डायरेक्टरेट ऑफ आयुष जम्मू एंड कश्मीर हेल्थ एंड मेडिकल एजुकेशन डिपार्टमेंट का
Okay. Another name, another yoga instructor to call upon to be on stage for receiving certificate is Zahida Parveen from district Badgaon. So now I would like to call Mazia Farooq from district Pulwama. Mazia Farooq. Now I would like to call Nuzhat Fayaz from district Badgaon to receive the certificate. Big round of applause, please.
यूनिट्स जो पहले इंटरनल अरेंजमेंट बेसिस
Now
पर
I would
चलाए
like
जा
to
रहे
call
थे,
Afreen
उनका
Nabi from district
रेगुलराइजेशन
Ganderbal.
करके उनमें पोस्ट क्रिएट की गई हैं जिससे
Another
डिस्ट्रिक्ट
instructor
लेवल्स
is
पर
Saima
लोगों
Manan
को
Bhatt
आयुष
from
सेवाओं
district
का लाभ
Srinagar.
अपने नजदीक
So,
मिलता है।
Put your hands together,
इन
please.
सुविधाओं का
Thank
और विस्तार करने के लिए
Now another
50
instructor to
बेडेड
receive
इंटीग्रेटेड
certificate is
आयुष
Muhammad Shaban from district Pulwama.
Unani medicine
One more
is a
instructor is
comprehensive
Arif
medical
Ayub
system
Mangru from
which
district
meticulously
Kulgam.
deals with the various states of health and disease. It provides promotive,
Now another one is
preventive,
Moomin Fayaz Khan
curative
from district
and
Srinagar.
rehabilitative healthcare. Is holistic in nature and considers individuals in relation to the environment
Another instructor is Shabir
and
Ahmad
stresses on
Wani
health
from
of
district Baramulla.
body, mind and soul.
Shabir Ahmad Wani from district Baramulla.
और
Temperament
आयुष के
or
अन्य
मिजाज
स्पेशलाइज्ड
of a patient
सुविधा भी
is
Now
given
another
great
instructor is
importance
Irshad
in
Ahmad from
diagnosis and
district
treatment.
Bandipora.
यहाँ की आयुर्वेदिक गवर्नमेंट आयुर्वेदिक
Natural
हॉस्पिटल की यहाँ
remedies
की थी
Irshad Ahmad
used
from
are
district
mostly
Bandipora.
derived
And
खाना
now
साहब के बारे में
from plant
बताएं
sources.
Shahbaz Ahmad Dar from district Badgaon. Big
Medicine
round
has
of applause for
evolved in
all the
different
yoga
parts of the world
instructors.
by imbibing observations and experiments of many
Thank you so much, sir.
civilizations.
Thank you.
After getting introduced to India in the 8th century, Unani medicine was enormously developed by physicians and scholars of India
Thank you, sir.
to take it to its present state. Today, it forms an integral part of the healthcare delivery in the country.
कार के लेबोरेटरी
Besides India,
टेस्ट की सुविधा भी
Unani medicine is
मरीजों को
presently practiced and
न
prevalent
केवल मरीजों के लिए
Bangladesh,
सुविधा है
Sri Lanka,
बल्कि रिसर्च के
South
दृष्टिकोण
Africa,
से भी
and
एविडेंस
certain
ऑफ
other countries
एफिकेसी
in the
I am
world.
overwhelmed to announce that today
With the
MD
largest
NIY has
network
signed
of
an
अस्पतालों
educational,
की
with
बेड
development of
research
Ayush
and
Clinic for
healthcare
various
infrastructure
research
है
and
Government of
activities
India
and to
passionate.
promote health and
OPD
wellness.
एवं
India is the
Extend
world
the
leader in
presence
Unani
of
medicine.
honorable ministers and other
Unani
dignitaries.
Day
May I
is
request
celebrated
Director MD NIY IV Baswa Reddy and Dr. Mohan Singh, Director Indian System of Medicine
नेशनल
Ayush
हेल्थ
JNT
मिशन
to
में
come on the
कार्यरत
days to do the
आयुष
honors.
डॉक्टर्स के
Please.
लिए कॉम्प्रिहेंसिव हेल्थ केयर थ्रू आयुष इंटरवेंशंस जम्मू और कश्मीर प्रांत में कार्यरत लगभग 100 आयुष
round of
डॉक्टर्स
applause.
को आयुष के स्पेशलाइज्ड प्रोसीजर्स पर हैंड्स ऑन ट्रेनिंग दी गई है
Thank you so
ताकि
much, sir.
पीएचसी और सीएचसी स्तर पर आयुष सेवाओं में बढ़ोतरी की बेहतर इंटीग्रेशन की
As
जा
we
सके
all know that
जम्मू कश्मीर
yoga
प्रदेश
cultivates
में
the
आयुष
ways to
विद्यार्थियों को
maintain
हाई
balanced
क्वालिटी
attitude in
आयुष
day-to-day
शिक्षा
life
आयुर्वेद
and
और
endorse
यूनानी
in
में
the
मिल
performances
सके
of
और उन्हें
one's
बाहर
action.
के राज्यों
So
में
let's
आयुष
witness a
कोर्स के
live
लिए
yoga
न जाना पड़े
performance by yoga
इसके लिए
instructors of
जम्मू
Ayush
कश्मीर
and
में
Health.
स्टेट
The
गवर्नमेंट
performers
आयुर्वेदिक मेडिकल
are
कॉलेज
Irshad Ahmad from district
जम्मू
Bandipura,
और
Shahbaz
गवर्नमेंट
Ahmad
यूनानी
from
मेडिकल
district
कॉलेज
Badgaon,
गांधरबल कश्मीर
Mr.
की
Anil
स्थापना
Yogi
की
from
गई
Jammu,
जिसका
Mr.
उद्घाटन
Neelam Kumar
ऑनरेबल
from Jammu
केंद्रीय
and
आयुष
Mr.
मंत्री
Dalip
श्री
Kumar from Delhi.
सर्बानंद सोनोवाल और
So
ऑनरेबल
let's
एलजी
have a
श्री
big round of
मनोज
applause
सिन्हा
for
जी
all
ने
these performers. Start, please. हो रहा है. Please start. Thank you.
पड़ा है। ये मत कहो खुदा से मेरी मुश्किलें बड़ी हैं, ये मुश्किलों से कह दो मेरा खुदा बड़ा है, मेरा खुदा बड़ा है, मेरा खुदा बड़ा है। शक्तियों से जब साथ है हमारे, वो सर्व शक्तियों से जब साथ है हमारे, हर काम उसके रहते हर गिज़ हुआ पड़ा है। कभी हारना ना, हिम्मत का कदम बढ़ाओ, कभी हारना ना, हिम्मत का कदम बढ़ाओ, हजारों कदम बढ़ाने वो सामने खड़ा है। ये मत कहो खुदा से मेरी मुश्किलें बड़ी हैं, ये मुश्किलों से कह दो मेरा खुदा बड़ा है, ये मुश्किलों से कह दो मेरा खुदा बड़ा है, मेरा खुदा बड़ा है, मेरा खुदा बड़ा है, मेरा खुदा बड़ा है।
Thank you so much. Thank you for performing live yoga. Thank you once again. Now I request the honorable ministers and dignitaries on the dais to release the CCRUM publications. So please, big round of applause, please. So the first publication to be released is Orientation Guidelines for Community Health Officers under Unani stream. The document comprises guidelines for community health officers under Unani stream working at Ayush Health and Wellness Centers established under Ayushman Bharat scheme of Government of India. The guidelines provide an initial structure for capacity building of community health officers and their team, comprehensive information on different activities to be undertaken at Ayush Health and Wellness Centers, description of practices for promotion of health, prevention and control of diseases through Unani measures and intervention. Big round of applause. The first book to be released is Orientation Guidelines for Community Health Officers. Thank you, sir. The next book to be released is National Formulary of Unani Medicine NFUM Part 4, 2nd edition. For this, I will request Professor M.C. Sharma, Chairman Scientific Advisory Body PCIM and H, and Dr. G.V.R. Joseph, Joint Director PCIM and H, to join the dignitaries on the days for release. Big round of applause. It's a revised 2nd edition of National Formulary of Unani Medicine for Part 4, first published in 2006. Official document for Unani formulations. The present part covers description of 166 Unani formulations in 7 different dosage forms. And the key feature of this revised edition is the incorporation of modern manufacturing advancements in the field of Unani pharmacy. Thank you, sir. The next book to be released is Advanced Analytical Methods for Quality Control of Unani Drugs, Arakiyat, Distillates. For this, I will request Dr. Saeed Ahmad, Associate Professor, School of Pharmaceutical Education and Research, Jamia Hamdard, to join the dignitaries on the days for release. Please, sir. Big round of applause. The book encompasses detailed quality control studies of Arakiyat mentioned in Unani Pharmacopoeia of India. Arakiyat are the aqueous distillates of drugs used as a classical Unani formulation since ancient times. And the book consists of 8 chapters covering quality control analysis of 10 Araqiyat. So big round of applause for this release. So the next book to be released is Adwiya Kabidiya Qadim o Jadid Tahqiqat ki Roshani mein, Urdu, a compendium of classical and evidence-based Unani drugs acting on the liver. The compendium provides an account of Unani drugs useful in protection of liver and treatment of its disease. The book comprises of time-tested Unani prescriptions for diseases of liver, useful Unani single drugs for liver and its diseases, and useful classical formulation for liver and its diseases, and evidence-based Unani single and compound drugs acting on liver. So big round of applause for this publication. Now one more publication to be released is Glimpses of Activities and Achievements of Central Council for Research in Unani Medicine. The booklet briefly introduces Unani medicine and outlines an overview of CCRUM, its institutional network and infrastructure, activities and research programs, achievements, recent developments and initiatives, as well as important events. It also details the important role of CCRUM during the times of COVID-19 pandemic. So big round of applause for this release as well. Now one more publication to be released is Anti-Arthritic Plants in Unani Medicine. The document comprises description on some Unani medicinal plants useful in management of arthritis. The detail for each plant has been provided under the headings of botanical as well as other names of the plant, botanical description, part used, temperament, usage, dosage, important formulation and other relevant information. It is anti-arthritic plants in Unani medicine. Now one more publication to be released is Hepatoprotective Plants in Unani Medicine. The document comprises description on some Unani medicinal plants useful in protection of liver. The detail for each plant has been provided under the headings of botanical as well as other names of the plant, botanical description, part used, temperament, usage, dosage, important formulation and other relevant information. So big round of applause. Thank you, sir. One more publication to be released is Riyazul Adwiya, Urdu translation, an important treatise on Unani single and compound drugs written by Yusuf bin Muhammad bin Yusuf, a 16th century Unani physician and Persian. It carries hundreds of brief and valuable description of hundreds of Unani drugs. So big round of applause for this book as well. Thank you, sir. Thank you so much. So let's move forward for launch of conference Souvenir. Souvenir Unani Day 2022, an international conference on diet and nutrition in Unani medicine for good health and well-being. The souvenir comprises of messages from dignitaries including Honorable President, Vice President and Prime Minister of India. It also contains program schedule and bio sketches of resource persons. So big round of applause for this as well. Thank you so much, sir. Now it's time for launch of Unani e-books prepared by National Institute of Indian Medical Heritage, Hyderabad. So I request Sri Sarbanand Sonowal, Honorable Union Cabinet Minister, to do the honors. So first e-book is Al-Qanun fi Tibb, the Canon of Medicine. Al-Qanun fi Tibb was written by legendary Ibn Sina in 1025 AD in Arabic. It is one of the most influential and monumental treatises in Unani medicine, which consists of 5 volumes. It presents a clear and organized summary of all the medical knowledge of the time, and it set the standards for medicine in medieval Europe and was used as a standard medical textbook through the 18th century. So one more e-book which is going to be released is Kamilus Sana'u al-Tabiyat, Encyclopedia of the Art of Medicine. Kamilus Sana'u al-Tibiyat was written by Ali ibn al-Abbas al-Majusi in 980 AD in Arabic. So it is considered one of the 3 greatest reference books on which the Unani medicine is based. It is divided into 2 discrete parts, theoretical and practical. First part consists of 265 chapters and covers theoretical medicine, and the second part has 518 chapters and covers practical medicine. Thank you so much, sir. Now, it's a matter of extreme pleasure to announce the release of CCRUM apps, and I once again request Honorable Union Cabinet Minister Sri Sonowal ji to do the honors. And the first app to be released is Single Unani Drugs. Unani medicine has a rich collection. It is single Unani drugs. Unani medicine has a rich collection of information on single drugs which are documented in the classical texts as well as Unani pharmacopoeia. Single Unani drug mobile application by CCRM has been created with the objective of providing hands-on information on single drugs, their temperament, uses, important formulations, and dosage to Unani professionals and other stakeholders. One more app is Unani Treatment Guidelines for Common Diseases. The Unani Treatment Guidelines for Common Diseases mobile app being launched by CCRUM provides a Unani physician with easy access to information related to treatment of common diseases that a physician comes across during clinical practice. It contains details about the principles of treatment, pharmacotherapy through single and compound drugs, regimenal therapy, dietary recommendations and restrictions, and prevention precautions related to the disease. One more app is Know Your Temperament. So every individual has a unique temperament. Identification of temperament of an individual is important to maintain health, diagnose and treat various diseases. Know Your Temperament is a web-based temperament identification system which calculates the temperament of the individual through a simple quiz. So it also includes advice on the most suitable diet for that temperament. Thank you. Big round of applause. Ladies and gentlemen, bringing standards in healthcare is one of the mandate of Ministry of Ayush. In the same context, CCRUM has taken an initiative of accreditation of healthcare facilities. I am overjoyed to inform that one of its peripheral institute in Srinagar has received certificate of NABH accreditation, and to present the same in the presence of our honorable ministers and dignitaries, may I request Dr. Atul Mohan Kochar, CEO NABH, to present the certificate to Professor Asim Ali Khan, DG CCRUM. So let's put hands together. Big round of applause for the same. Thank you. Thank you, sir. Thank you, sir. Now let's move forward and let's watch a short video which has been prepared by social media team of CCRUM headquarters. The video showcases the current status of Unani medicine of India. So let's watch it, please.
Unani medicine is a comprehensive medical system which meticulously deals with the various states of health and disease. It provides states of health and promotive, preventive, it provides curative, promotive, and rehabilitative healthcare. Curative is holistic in nature, rehabilitative healthcare, and considers individual is holistic in relation to the environment, and considers individual and stresses on relation to the environment, body, mind, and stresses on health of body, temperament, or misaj of a patient is given great importance in diagnosis and treatment of disease. Is given great importance in diagnosis and treatment. Natural remedies used are mostly derived from plant sources. Unani medicine has evolved in different parts of the world by imbibing observations and experiments of many civilizations. After getting introduced to India in the 8th century, Unani medicine was enormously developed by physicians and scholars of India to take it to its present state. to take it today
to its present
it forms
state.
an integral part of the healthcare
Today,
delivery in the country.
it forms an integral part
Besides
of the
India,
healthcare delivery in the country.
Unani medicine is presently practiced in
Besides
prevalent
India,
in Bangladesh,
Unani medicine is
Sri
presently
Lanka,
practiced in prevalent
South Africa,
in Bangladesh,
and certain
Sri
other
Lanka,
countries in the world.
South Africa, and certain
With the
other
largest
countries in the
network
world.
of educational, research,
With the
and
largest
healthcare
network
infrastructure
of educational,
under the
research,
Government of India
and
patronage,
healthcare
India is the world leader
under
in
the
Unani
Government of
medicine.
India patronage. India is the
Unani
world
Day
leader
is
in
celebrated on 11th February,
Unani Day is
which
celebrated
marks the birth anniversary of
on
Hakim
11th
Ajmal
February,
Khan,
which
who
marks
was
the
a
birth
great
anniversary of
educationist, freedom fighter, and an eminent Unani physician.
freedom and an eminent Unani physician.
Thank you so much for this wonderful short video. Now, it's a moment of exquisite delight for me to invite Visionary Leader of Ministry of Ayush, Chief Guest Sri Sarbanand Sonowal, Honorable Union Cabinet Minister, Ministry of Ports, Shipping and Waterways, and Ministry of Ayush, Government of India, on days to present his inaugural address. Sir, we would be delighted with your illuminating words. So, big round of applause.
नमस्कार। ladies and gentlemen, and my media friends. Today is a great day for the Unani system of medicine. And in this auspicious occasion, I pay my deep tribute to Hakim Azmal Khanji, who has been the founder of scientific research in Unani medicine and who had contributed a lot for the cause of the country. Today, we must acknowledge and also appreciate and must express our gratefulness to our Honorable Prime Minister Narendra Modi ji. Because of his untiring, devoted and committed effort, the Ministry of Ayush has been successful in extending its service to the people of the country and also people of the globe. So I believe this is a golden opportunity for all the practitioners, healers in this traditional system of medicine for centuries together. And I believe this is one of the ancient system of medicine. For centuries, the people of the country had been practicing, and they have been, during their lifetime, they have been trying their best possible effort to promote this system. And today, in the 21st century, in the age of science and advanced technology, this generation of human society got an opportunity to promote it with scientific research, validation, and also our serious study on the availability of the medicinal quality in nature, in our beautiful planet Earth. So today we are observing International Unani Day. So this particular day is significant for all of us to remember our forefathers who have been practicing during their time, and because of this particular wisdom and knowledge which has percolated to this generation, and we have inherited the skill from them, and ultimately we are also trying to put our effort to promote this system of medicine so that human health can be well preserved and protected, and also to strengthen for a better health tomorrow. So I believe now whatever we have been doing in the country, it has been recognized by the global society. As a result, Ayush product could create a huge global market, acceptability, credibility. That is why now our responsibility is growing far more, bigger, and tomorrow we will have to produce more and more quality service, quality medicine, and quality our research and quality findings, so that this system of medicine can ensure the preservation of human health and also they strengthen their dignified existence of life. I believe with this particular objective, we'll have to move forward, and we are all lucky enough to have a leader who has always been trying to inspire every Indian citizen in the different field of human activities, which can empower our existence with better living, pride, prestige, and dignity, and well-being. So I believe in this particular age of competition, and we all must put our hand together to develop our strength and energy, to develop our skill, to develop our wisdom, to develop our will, so that we could create an environment through which the global society can feel well guarded, well protected out of our important creation, our important invention, and also important initiative. So I'm really thankful to all of you present here today. And Jammu and Kashmir, one of the most beautiful region of the country, we are all proud of this particular beautiful area of the country. And this particular region has always been contributing to the growth of the beauty of the country. And also, this particular area has been successful in developing a beautiful site for the global tourists to come, and developing an attraction of that kind, which can also provide kind of peace and happiness. So I believe to that extent we'll have to always bear the responsibility to make this particular region always peace and full of tranquility and full of happiness and full of comfortability for all the visitors, whoever is visiting to this beautiful region. And particularly, I would be happy if our student friends, faculty members, they could all be having very much kind of free and frank interactive session within themselves on this auspicious occasion. And we'll have to develop our future vision plan. So what we are going to give tomorrow for the rest part of the country and rest part of the world. So this is the way we'll have to have our discussion within ourselves. Let us have brainstorming session. And today, I'm really happy that we are having an international conference. In this particular conference, renowned scientists, researchers, and faculty members from UAE, Iran, United Kingdom, USA, Malaysia, Sri Lanka, South Africa, Bangladesh, they have been virtually connected with this spacious occasion. I extend my heartfelt greetings to all of you virtually connected in this particular session. I hope in this global society will have to join hand to each other through our collaborative effort, collaborative research, collaborative studies, and find out the way how to extend our best possible service to the mankind, to the people of the world. So I believe every initiative always mean for that mankind, that kind of human endeavor involved. So I believe with that particular kind of vision, kind of mission, we'll have to proceed together. That is why nowadays Ministry of Ayush, Government of India, joining hands with many foreign countries for our collaborative research and studies, and also there are many more foreign students who have been taking undergraduate, postgraduate and PhD degree in the Indian universities in this particular traditional system of medicine. So I believe this is a very, very good move for all of us. And nature has provided us enormous scope. In nature we have lot of resources. Whatever potentialities, possibilities and prosperities are there in nature, that is to be detected, discovered through our scientific study. Even in the beautiful this Jammu and Kashmir, Ladakh, whatever resources are available, now the young generation will have to put their best possible effort to find out those resources, those medicinal quality species, and through their scientific studies. So this dedicated initiative need to be taken by the young generation, and our entire effort will be mainly to serve the mankind. That must be always kept in your mind. So I believe this is my appeal to all of you. Please come forward and try to boost this particular system of medicine which has been there for centuries together. And now in this age of science and technology, we'll have to add more kind of advanced, value-added thought process into it. And we'll have to incorporate it, lot of our devoted efforts, so that many more which is not yet being discovered can be discovered through our serious studies and research. And I believe we have got that level of wisdom and energy and capabilities to handle this kind of situation. Now you will be happy enough that because of the Honorable Prime Minister Narendra Modi's able leadership, WHO has decided to set up Global Center for Traditional Medicine in India. This is a landmark kind of achievement, outstanding kind of achievement on the part of the people of the country. Now, once this particular center is set up in the premises of Training and Research Institute, Jamnagar, under Ministry of Ayush, this will take the leadership on all kind of global health matter related to traditional medicine. It will also connect with all the member states of WHO. It will also identify the challenges in the matter of regulating, integrating and positioning of the traditional system of medicine in the member nations of WHO. So it means India will take the leadership. This is an opportunity, and this opportunity must be availed by our young generation, by our researchers, by our scientists, by our faculty members. And this particular message needs to be percolated to the ground, to the young generation, so that they could also admire this particular path of putting their human effort for the growth of this traditional system of medicine. So this is I think, I do not know to what extent you have been assessing all this kind of development, but we must extend our heartfelt gratitude, thankfulness to Honorable Prime Minister Narendra Modi ji because of his single-handed effort, because of his global influence. This particular center has come to India despite of many resistance from many sectors. So I believe we must salute Honorable Prime Minister Narendra Modi ji. And this is an opportunity for all of you. Ayurveda, Unani, Siddha, Soharikpa, Yoga, Naturopathy, Homeopathy, all system of Ayush will get an opportunity now to capture the global market, to access to the global society, to serve the global society from the front. So within the span of 7 years, during the time of 7 years regime of Honorable Prime Minister Narendra Modi ji, within a brief period, look at the performance, the level of performance, the level of achievement. So that is why we are all proud of his initiative, and because of his continuous, untiring effort, this Ayush will definitely grow faster. Like he has brought a new concept in our entire journey of development, Prime Minister Gati Shakti National Master Plan, and that is multimodal connectivity. That means whatever speed we have in our development, that is to be incorporated by our energy and wisdom through this integrated effort. Integrated effort means all the system of Ayush will join hands to each other and putting their effort unitedly so that we can empower ourselves to make our ability visible to the global society, to serve the global society with credibility, with acceptability, with sustainability. I believe to that extent, we'll have to carry our journey forward. And today, Unani Day, it's a beautiful occasion we have been organizing here at beautiful place of India, Srinagar. And I believe in my last visit also, मैंने जो देखा है, आप लोगों का जो मेहनत है, जो आप लोगों का निष्ठा है, इसकी वजह से आज यूनानी ने अपना पहचान बनाने में सफलता प्राप्त की है। तो यूनानी सिस्टम में जुड़े हुए सारे हमारे फैकल्टी मेंबर्स हो, रिसर्चर्स हो, साइंटिस्ट हो और प्रसिद्ध हमारे जो भी व्यक्ति और जो भी प्रैक्टिशनर्स हो, हीलर्स हो, सबको मेरे दिल से प्रणाम। क्योंकि आप लोगों ने एक साथ मिलकर निष्ठा पूर्वक आप लोगों ने मेहनत किया है। क्योंकि हर चीज को आगे बढ़ाने के लिए हर व्यक्ति को विशेष रूप से श्रद्धापूर्वक निष्ठा से मेहनत करना होता है। जीवन में सफलता ऐसे प्राप्त नहीं होती। सफलता प्राप्त के लिए अपने आप को जोड़ना पड़ता है कर्मभूमि में। निष्ठापूर्वक, श्रद्धापूर्वक अपने कर्मों में तन, मन और आत्माओं को जोड़ना पड़ता है, तब जाके सफलता प्राप्ति होता है। तो इसलिए पिछले दिनों में भक्ति भावनाओं से परम आदरणीय प्रधानमंत्री जी ने जो मेहनत की है, इसके वजह से आज दुनिया ने आयुष का शक्ति देखने लगे हैं। और आयुष की द्वारा उत्पादित जो भी हमारे अलग अलग सामग्री है, अलग अलग हमारे दवाएं हैं, इससे कई बीमारियों से दुनिया की मानव समाज को राहत मिला है। इसलिए अपने शरीर को सुरक्षित करने के लिए, तंदुरुस्त बनाने के लिए और हर बीमारियों से बचने के लिए ये हमारे आयुष में जो यूनानी सिस्टम है, इस यूनानी सिस्टम ने जो रास्ता दिखाया है, जो एडवाइजरी दिया है, मुझे लगता है अगर ये एडवाइजरी हम निष्ठापूर्वक माने तो निश्चित रूप से हम हर बीमारियों से अपने आप को अलग रख सकते हैं, तंदुरुस्त रख सकता है। तो इतना तक हमें मन बनानी होंगे और तब जाके हमारे देश की शक्ति, हिंदुस्तान की शक्ति दुनिया को हम दिखा सकते हैं और उसी दिशा पे हमको जाना ही होगा। अब हमें जो WHO का इतना बड़ा रिकॉग्निशन मिला है, इतना बड़ा स्वीकृति मिला है, इसलिए रिकॉग्निशन के लिए परम आदरणीय प्रधानमंत्री जी का साथ मैं सदियों से जिन लोगों ने इस पद्धति से जुड़े हुए हैं सबको मेरे तरफ से बहुत बहुत अभिनंदन, क्योंकि उन लोगों ने जो मेहनत की है, जो तपस्या की है, उनकी तपस्या, उनकी मेहनत आज उनको स्वीकृति मिले है। तो इसलिए मैं मानता हूं अगले दिनों में हम ऐसे ही हमारे आयुष का हर पद्धति को हम विशेष रूप से हम मान्यता देते रहेंगे और शक्ति बढ़ाते रहेंगे। और माननीय प्रधानमंत्री जी का जो मंत्र है, प्राइम मिनिस्टर गति शक्ति नेशनल मास्टर प्लान, इसी गति शक्ति का नीति के आधारित हम सब जोड़ जाएंगे। हमारे बीच जितना भी शक्ति है, ज्ञान है, भक्ति है, निष्ठा है, हमारे साहस है, हमारे जुनून है और सारे मानव शक्तियों को हम एक साथ मिलाकर महाशक्ति बना के हम विश्व को जीतेंगे। तो मुझे लगता है कि उसी दिशा पर हमें अपने सारे आयुष आंदोलन को बढ़ावा देना होगा। I believe to that direction we'll have to carry our entire activity forward with ability and wisdom। और इस जम्मू कश्मीर लद्दाख में जो शक्ति है, इस शक्ति हिंदुस्तान को आत्मनिर्भर बनाने में बहुत बड़ा योगदान दे सकते हैं। तो इसलिए मैं आप सबको आग्रह करता हूं, आप उसी दिशा पर लगते रहिए और उसी दिशा पर आप मेहनत करते रहिए। और हमारी तरफ से मैं इस विभाग के मंत्री होने के नाते इतना ही कह सकता हूं कि आज आप लोगों ने जैसे इस सभा को, इस ओकेजन को सफलता पूर्वक उसको निष्ठा से पालन करने के लिए जो कदम उठाए हैं, इसके लिए आप सबको मैं हृदय से धन्यवाद देता हूं। और ऐसे लगे रहिए। हमारे खान साहब जो है तो उन्होंने भी सारे सिस्टम को आगे बढ़ाने में बहुत बहुत मेहनत किया है। हमारे आयुष विभाग के शायद हमारे मंत्री, साथी मंत्री डॉक्टर मंजूपारा महेंद्र भाई और हमारे सेक्रेटरी डॉक्टर राजेश कटेसिया जी, स्पेशल सेक्रेटरी पाठक जी और हमारे सामने बैठे हुए सभी, नसेरा जी हो, त्रिगुणा जी हो, बसुराहा जी हो और हमारे जगन्नाथन जी हो, सबका मैं नाम उल्लेख नहीं किया हूं, लेकिन दिल में उन के लिए मेरा जगह है। तो सबको मैं बहुत बहुत धन्यवाद देता हूं। आज हमारे दो माननीय वाइस चांसलर आके हमें आज जो मार्गदर्शन दी है, दोनों को मैं विशेष रूप से धन्यवाद देता हूं और जम्मू एंड कश्मीर सरकार को भी मैं धन्यवाद देता हूं। आप लोगों ने भी यहाँ एडिशनल चीफ सेक्रेटरी ने आके भी राज्य हमारी इस सरकार की तरफ से जो उन्होंने सहयोग की है, इसके लिए मैं उनको भी धन्यवाद देता हूं। तो ऐसे हम सब एक भारत श्रेष्ठ भारत, उसी नीति के द्वारा हमें कन्याकुमारी से कश्मीर लद्दाख तक और अरुणाचल प्रदेश से गुजरात तक ये बड़ा जो देश है, इस देश को एक साथ लेकर मोदी जी ने जैसे ही दुनिया का सबसे शक्तिशाली देश बनाने के लिए, आत्मनिर्भर भारत बनाने का उन्होंने जो भी विजन प्रस्तुत किया है, उसी दिशा पर हम सबको मेहनत करना होगा और उसी दिशा पर हमको मेहनत करके सफलता प्राप्त करना होगा। और हम ये बात निश्चित से कह सकता हूं जे अगले दिनों में हम उसी दिशा पर निश्चित रूप से सफलता प्राप्त करेंगे। उसी शब्दों का साथ मैं आज इस सभा में जुड़े हुए हर व्यक्ति को मैं विशेष रूप से फिर से धन्यवाद देता हूं। और आपको मालूम है पिछली बार आए थी तो हम मेडिकल कॉलेज एक हम लोगों ने यहां इनॉग्रेट किया था, तो आज इसमें बचे हुए जो सेंटर है इसको भी हमने सेंटर ऑफ एक्सीलेंस के हिसाब से हमने अनाउंस किया है। यानी कि आप चिंतित मत हुए, आपके लिए जो व्यवस्था सरकार की तरफ से देना जरूरी है वो हम देते रहेंगे, लेकिन आप हर फैसिलिटी को सही उपयोग कीजिए ताकि आप खुद को बना सके और हमारे देश को भी बना सके। उसी हिसाब से आप आगे बढ़िए। इसी शब्दों का साथ फिर से I extend my heartfelt greetings to all of you. Special thanks to all of you and present here in the auditorium and also whoever have connected from abroad virtually. I also extend my thankfulness to all of you. Please let us work together so that we can empower ourselves, we can serve the mankind. Thank you. Jai Hind.
Thank you, sir, for these encouraging words. Indeed, under the dynamic leadership of our Honorable Prime Minister Shri Narendra Modi ji, many new initiatives for traditional system of medicine, including Unani medicine, have been taken. Thank you so much. Now it's time to watch a short video prepared by Department of Indian System of Medicine's Ayush J&K. So big round of applause for this short video.
नमस्कार, मैं डॉक्टर मोनिका गुप्ता, डायरेक्टरेट ऑफ आयुष J&K की ओर से आप सबका स्वागत करती हूँ। डायरेक्टरेट ऑफ आयुष जम्मू एंड कश्मीर हेल्थ एंड मेडिकल एजुकेशन डिपार्टमेंट का एक संगठक विभाग है। 1987 में गठित डायरेक्टरेट ऑफ इंडियन सिस्टम्स ऑफ मेडिसिन जम्मू कश्मीर को मिला है एक नया नाम, एक नई पहचान, आयुष। आयुष का अर्थ है लंबा सेहतमंद जीवन। आयुष जम्मू कश्मीर का लक्ष्य है अपने नाम के अनुसार पारंपरिक और प्राकृतिक इलाज के तरीकों में हेल्थ प्रमोशन, डिजीज प्रिवेंशन और डिजीज मैनेजमेंट को आम लोगों तक पहुंचाना, ताकि वे लंबा और हम सहयोग कर सकें स्वस्थ जम्मू कश्मीर एवं सशक्त भारत के निर्माण में।
जनगण मन अधिनायक जय हे भारत भाग्य विधाता। पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंगा। विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा। तव शुभ नामे जागे, तव शुभ आशीष मांगे। गाहे तव जय गाथा, जन गण मंगल दायक जय हे भारत भाग्य विधाता। जय हे जय हे जय हे जय 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 हे।
have a lunch break. We would have a lunch break of half an hour. ठीक है. Now we will have a lunch break for half an hour, and after half an hour we will come back for the panel discussion. So kindly join us on time, please. Thank you.
I request all panelists to switch on your videos and keep yourself muted. In the meanwhile, I request all the panelists to switch on your video and unmute your mic and say hello, hello, so that we will check that everything is okay from your end. Otherwise, during the live session, it will be very difficult for us to communicate.
Good afternoon. I am Dr. Selvamurthy.
Just a second, sir. Just a second. Yeah, please say, sir.
Good afternoon. I am
Yeah.
Dr. Selvamurthy.
Perfectly fine, sir. Perfectly fine, sir. Next, please.
Very good afternoon to all. Myself, Dr. Santosh Joshi
Right, sir.
from
Right, sir. Perfectly fine, sir. Perfectly fine. Next. Next, please.
Myself is Professor Dr. Muhammad Kamil, Lotus Holistic, Abu Dhabi.
Right, sir.
Actually, Madam Amina.
Yes, yes.
Madam Amina, I am replacing Madam Amina Al Haidan.
Okay, okay, okay. Okay. Dr. Farooq, you can also say something.
Assalamu alaikum.
Perfectly fine.
Everyone out there, please come inside for live.
So I'm
Panel
switching off the video.
discussion
I may not
session
be
is
quickly
going to
because
get
I'm sitting in the
started
same
very
hall.
soon.
So
So
once your turn will
please come
come,
inside.
we'll send you a notification to switch on your camera and we'll make you live here in the physical room.
By what time you will start, sir? Hello.
किन के लिए जो पैनलिस्ट यहाँ पे हैं विच मैम ये जो मॉडरेटर साला स्पीकर साला मैं अच्छा पता कमेंट किया मॉडरेटर साला जो अब ज़्यादा है आपने त्रिगुणा देवेंद्र त्रिगुणा कुछ है ये पुजारी ये मुझे नहीं होगा नहीं आप इनसे पूछो पहले पहले ही पहले ही पहले ही बट फिर भी आप मैम टेक्निकल सेशन में या It's my humble request to everyone out there, please come inside Hall A because the panel's discussion is about to get started very soon. So, because panelists are very much with us, some of them are online, they will join us through virtual mode and already joined? Okay. They have joined us actually on through virtual mode. So please come inside so that we will get started again with this panel discussion session. Let me? Okay. हाँ ठीक है सर ठीक है Okay. Okay. So it's a matter of extreme pleasure to welcome you all. So as earlier informed, we will begin proceedings of Unani Day celebrations with panel discussion. Ladies and gentlemen, for this panel discussion, we have keynote speakers to speak on the theme Diet and Nutrition, an important branch in health sector. Moderators for this session are Asim Ali Khan, Director General Central Council for Unani Medicine, New Delhi. He is member of many important government committees. He has represented our country in many national and international conferences. So big round of applause. Please, sir, come on stage to grace our stage with your presence. Thank you, sir. Another moderator for this session is Professor Akbar Masood, Honorable Vice Chancellor Baba Ghulam Shah Badshah University, Rajouri, J&K. Professor Akbar Masood Saab is presently working as Vice Chancellor Baba Ghulam Shah Badshah University, Rajouri, J&K, India. Before taking over as Vice Chancellor Baba Ghulam Shah Badshah University, Dr. Masood was a Professor of Biochemistry at Kashmir University and served it in various capacities, that is Head of Department and Dean Academic Affairs. He contributed immensely in popularization of biochemistry and launch of many new departments at the university. Sir, welcome. Please grace our stage with your presence. Thank you. One more moderator with us is Professor Muhammad Afzal Zargar Sahab, who is Professor, Department of Biotechnology, School of Life Sciences, Central University of Kashmir, J&K. Professor Muhammad Afzal Zargar Sahab is presently Professor of Biotechnology, School of Life Sciences at Central University of Kashmir. He had an academic career spanning over 27 years. He joined as a second registrar of the Central University of Kashmir in September 2013. Professor Zargar has authored several books and has more than 100 international national research articles published in revered journals to his credit. 34 research scholars have completed their research degree programs under his guidance, and he is rated as one amongst the excellent teachers, researchers, and administrators of the UT of J&K. So big round of applause, and please grace our stage with your presence. हाँ मैम यहाँ तो है. The keynote speakers for this session who will talk on the theme Diet and Nutrition, an important branch in health sector, are Professor Abshir Alam, who will join us through virtual mode, Professor Talat Ahmed, Vice Chancellor University of Kashmir, Srinagar, J&K, Vedi Devendra Triguna, President Association of Manufacturers of Ayurvedic Medicines, New Delhi, Dr. S. Vedi Jayanti Yashwantiya Pujari, Chairperson, National Commission for Indian Systems of Medicine, New Delhi, Dr. S. Farooq, President, Himalaya Drug Company, New Delhi. He will also join us through virtual mode. Dr. W. Selva Murthy, President, MET Science, Technology and Innovation Foundation, Director General, MET Directorate of Science and Innovation, Noida. ये भी हमें online ही join कर रहे हैं. Dr. Pradeep Multani, President, PhD, CCI and Chairman, Multani Pharmaceuticals Limited. He is also joining us through online mode. Dr. Asad Mueed, Executive Director, Hamdard Laboratories, Medicine, Duju. And Dr. Hamid Ahmed, President, Unani Drug Manufacturers Association, New Delhi. Dr. Muhammad Ashraf Ganai. Okay. Okay.
Mr. Santosh Joshi is representing Dr. Asad.
Dr. Asad Mueed.
VC Hamdard नहीं आ रहे, उनको represent कर रहे हैं संतोष जोशी.
इनको Dr. Asad Mueed को. अच्छा डॉक्टर असद मुईद साहब नहीं आ रहे हैं. Okay. So let me announce it again that Dr. Asad Mueed, Executive Director, Hamdard Laboratories, Medicine, Dujan, is not coming, but he is being represented by Mr. Santosh Joshi. And one more speaker with us will be Dr. Hamid Ahmed. He's not also coming? Hamid, okay. Let me correct it again. Dr. Hamid Ahmed, President Unani Drug Manufacturers Association, New Delhi. He is not able to join us today. So one more speaker with us is Dr. Muhammad Ashraf Ganai, Professor, Department of Endocrinology, SKIMS, Srinagar, J&K. Dr. M.A. Waheed, Member, Governing Body, CCRUM. He is also joining us through online mode. Dr. Saima Rashid, Principal, Unani Medical College and Hospital, Gandharbal, J&K. Professor Abdul, yes sir. Okay. Okay. Dr. Hamid Ahmed is not joining us, but Dr. Mohsin Dahlvi is joining us for this panel discussion. Dr. Saima Rashid, Principal, Unani Medical College and Hospital, Gandharbal, JNK is also joining us for this session. Professor Abdul Wadood, Director, National Institute of Unani Medicine, Bengaluru. Professor KMY Amin, Professor in Pharmacology, Department of Ilmul Adwiya, Aligarh Muslim University, Aligarh. He is also joining us online mode. Professor MC Sharma, Chairman, Scientific Advisory Body, PCIM and H. The rapporteurs for this session will be Dr. Athar Parvez, RO, Unani IUM Srinagar, Dr. Saima Majid, MD Scholar, RIIUM Srinagar, Dr. Nusrat Jahan, SRF CCRUM, New Delhi, but she is going to join through online mode. Now I would like to request Professor Asim Ali Khan to present a bouquet as a token of love and respect to Professor Akbar Masood Saab, Honorable Vice Chancellor Baba Ghulam Shah Badshah University, Rajouri, J&K. Please. Big round of applause for the same. Thank you so much, sir. So I would like to request to do this honors again to present bouquet as a token of love and respect to Professor Muhammad Afzal Zargar, Registrar, Central University of Kashmir, J&K. Thank you, sir. Now I would like to request Professor Akbar Masood Saab to present bouquet as a token of love and respect to Professor Asim Ali Khan, DG CCRUM, Ministry of Ayush, Government of India. Thank you, sir. Thank you. Ghazala ma'am, speakers ने join किया हुआ है, मैं announce कर दूँ? Okay. Okay. Now I would like to request Professor Asim Ali Khan to present bouquet as a token of love and respect to Professor MC Sharma, Chairman, Scientific Advisory Body, PCIM and H. Please, sir. Now I would like to request Asim Ali Khan Sahab to present bouquet as a token of love and respect to Vedi Devendra Triguna. He is not coming? Okay. चले गए? इन्होंने नहीं बताया. Now I would like to request Asim Ali Khan Sahab to present bouquet as a token of love and respect to Professor Abdul Wadood, Director, National Institute of Unani Medicine, Bengaluru. Ghazala ma'am, वो नहीं है Professor Ashraf Ganai साहब नहीं है offline. वो ऑनलाइन है. वो भी हो गया. बाकी जो है उनको तो वेलकम करो. मैंने किया. इनको सबको कर लिया. हाँ. डॉक्टर एस फारूक सबका. Now I would request Professor Talat Ahmed, Honorable Vice Chancellor. Now I would like to request Professor Asim Ali Khan, DG CCRUM, Ministry of Ayush, Government of India, who is the moderator of this panel discussion on the theme diet and nutrition, an important branch in health sector, to go on with the proceedings. Thank you.
Assalamu alaikum and very good afternoon to all of you. I welcome all the esteemed panelists who are here with us on the dais, and also all the esteemed panelists who have joined us online for the discussion on this very important topic of diet and nutrition, an important branch in health sector. I think we all know that, and we all are doctors sitting here, and the people who have joined us are also the healthcare officials and healthcare workers, that nutrition is a very critical part of health and development. And better nutrition is related to stronger immune systems, longevity, and lower risk of diseases. Malnutrition is every form presents significant threats to human life and human health. We all know that today the world is facing a double burden of malnutrition that includes both undernutrition and overweight, especially in low and middle income countries. And furthermore, rapid changes in diets and lifestyles have occurred with industrialization, urbanization, economic development, and market globalization. And this is having a significant impact on the health and nutritional status of populations, particularly in developing countries. We have somehow, our standards of living have improved and food availability has expanded. But there also have been significant negative consequences in terms of inappropriate dietary patterns and decreased physical activities. There has been a shift in dietary patterns, and we have moved away from our traditional food practices. And today there is increased consumption of energy-dense diets, which are high in fat, particularly saturated fat, and low in unrefined carbohydrates. These are combined with a sedentary lifestyle. We are using motorized transport, labor-saving devices in the home. There are no physically demanding manual tasks in the workplace, and our leisure time is devoted to physically undemanding pastimes. And because of these reasons, in dietary and lifestyle patterns, there is an increase in disease patterns and diseases like obesity, diabetes mellitus, cardiovascular disorders, hypertension, and stroke, placing additional burden on already overtaxed national health budget. Today we are discussing this on this important day, on Unani Day, International Conference also we are organizing today and tomorrow. Many of our friends and scientists from different parts of the globe have also joined us. More than 1,500 delegates have online registered with us, and almost 600 people are here with us physically. In the morning session, we saw the inauguration of today's event, where Honorable Minister spoke and other learned speakers, the Vice Chancellors of both the universities, Akbar Masood Sahib and Talat Sahib spoke, and our colleagues from ministry spoke. They talked about education, they talked about many other things. And we got the motivation from the Honorable Minister Sahib. And we also got the highlighting understandings about what Honorable Prime Minister, how he has handholded, how he has guided and patronized the Ayush systems of medicine in particular, other than everything which we are seeing and growth in the country at the moment. I won't say much time because I have my co-panelists and co-moderators with me. And we have with us Professor Akbar Masood Sahib, he was Rajori, Professor Muhammad Afzal Zargar Sahib, a good friend of us, and he's the Registrar, Central University of Kashmir. And speakers, incidentally, Professor Afshar Alam Sahib is not available because he has some, because of his not good health, probably he has got some problem. Talat Sahib probably will be joining in the morning session. He was with us. He is joining probably online. Vedya Devendra Trigunaji, we wanted to listen him. Always, it was a pleasure to listen him. He is a very renowned Ayurvedic scholar and a wonderful physician of Ayurveda. Of his flight schedule, he had to go to the airport. Jain Dev Pujari Sahib, we heard in the morning, he's the chairman of National Commission of Indian System of Medicine. He also, because of the flight, because we got our morning schedule a bit late, so he also left with us from here. Dr. S. Farooq Sahib, like always, we have his hand-holding and guidance and patronization. Thank you very much, Dr. Farooq Sahib, who is the president of Himalaya Drug Company, New Delhi. He is joining us online. We have a very learned scholar who is the former Director General of DRDO, Government of India, and he is the president of MIT Science, Technology and Innovation Foundation. And he is also the Director General of MIT Directorate of Science and Innovation. A wonderful patron, a wonderful gentleman, a wonderful scholar who has always been available for us and hand-holding and guiding us, Dr. W. Silva Murthy Sahib. He is joining us online. Thank you very much, sir. We have Dr. Asad Mueed Saab was there with us, but because of some urgent schedule, he could not join us, and Dr. Santosh Joshi is joining on his behalf. We have Dr. Mohsin Dehlvi, who is from Dehlvi Remedies. He is joining us online. Professor Ashraf Ganai was here. Probably he will be joining soon. He is a professor in Department of Endocrinology, SKIM Srinagar, Jammu and Kashmir. We have Dr. M.A. Waheed. He is Padma Shri M.A. Waheed Sahib. He is a very good researcher, refined scientist and researcher in Unani system of medicine. He has his great know-how in management of vitiligo. He was a former director of one of our institutions in Hyderabad, which is now a national institution of Unani medicine for skin disorders. We have Dr. Saima Rashid, because there is some inspection in a college, probably she may not be able to join. Dr. Abdul Wadood Sahib is with us physically. He is the director of National Institute of Unani Medicine in Bengaluru. He is sitting on my right. Thank you very much, Dr. Wadood Sahib. Professor K.Y. Amin Sahib, he is a wonderful professor and very good academician and a teacher from Aligarh Muslim University. He is a professor in pharmacology and he is retired now, and he is a Department of Ilmul Adviya in Aligarh Muslim University he used to take care of. Professor M.C. Sharma Sahib, a very refined scientist and a person who has been guiding for, you saw in the morning we got one formulary and pharmacopoeia he is looking after. He is the chairman of scientific committee of the Pharmacopoeia Commission of Indian System of Medicine in Ministry of Ayush, Government of India. He is on my left. Thank you very much, Professor Sharma Sahib, for traveling all the way for joining for this panel session and the morning session also. Thank you very much. With this, I welcome all of you. I give the dais and I request. Okay, sure. I will request now Dr. Afzal Zargar Sahib to take over and please give his comments and invite the speakers, because one request has come because some online speakers. First of all, let me put my apology on record to online speakers that I forgot one. Dr. Pradeep Muldani Sahib, he's a wonderful friend, and Dr. Pradeep Muldani Sahib is the chairman of Multani Group of Companies. He is a wonderful gentleman as a person, a very good friend. He is the president of the PhD Chamber of Commerce. He is in many other things he is doing. He has always been hand-holding and available for us for the Unani cause. Thank you very much, Pradeep Multani Sahib, for always being available for us. He has been a regular feature on our panel discussions in the past also, in the Vigyan Bhavan when we used to do. Thank you very much, sir, for joining us online. I request you, sir, to please take over.
Thank you, Professor Asim Saab.
One second. I'm just sorry. I want to put on record that we got somehow delayed because function got somehow delayed, and we could continue till a bit late, and because of that I think we could all, our honorable ministers also, because of the flight schedule, they had to leave, and they left fast from this place. We could not even have the lunch together with them. So for that, my apologies on record for all the online speakers, particularly. Offline, at least they were there physically with us. I hope you will bear this delay. I'm sorry for that. Thank you very much.
Thank you, and I join Professor Asim Saab, the DG of the CCREM, in welcoming all who are present out here, both offline and online, for this panel discussion. Well, I will not take much of your time. I have 1 or 2 minutes only, because I understand that the experts have been waiting since long, and I also, on behalf of the CCRAM, also apologize on that to them, because the program started late. We are going to, the panelists are going to discuss on a very, very important topic, nutrition and diet, in terms of the Unani medicine and what is their role and important branch in the, being an important branch in the health sector. I must tell here that, we are nearing a situation when we are nearing a situation when actually we are focusing more on the nutrition and diet in the management of the diseases. Very soon the pills and the surgeries and the other things which we generally see in the allopathic kind of the medicine and the others will give way to the natural systems. Naturopathy will be there, and wherein we will be taking up we'll be making more focus on the nutrition and the diet. I understand that we are bound to listen to marvels from our experts, and we understand that if we look at our diet as of now, we understand that most of our diet is based on the processed food. About more than 51% of our diet is based on the processed food, and situation is such that if we concentrate only on the plant products and plant whole grains and plant products, we will be confronting and we will be resolving most of the issues that is presently with us. Without taking much time, I'm also welcoming all the panelists here, and it's my privilege to invite our Professor Talat Ahmed Saab, if he has joined us, the Honorable Vice Chancellor, University of Kashmir. Is Professor Talat Saab online? Okay. Okay. So now I have the honor to request Mr. Pradeep Multani Saab to just come over, and he's joined us online and make his point of view. Thank you, Mr. Pradeep Multani Saab. I think you are muted. Please unmute yourself.
Yes, please. Thank you.
Yeah, you are audible now.
Sure. Thank you very much. On behalf of PhD CCI, I would like to thank all eminent dignitaries who have joined today for this important international conference on Unani medicine. My dear brothers and sisters of our Unani family, Assalamu alaikum. PhD Chamber of Commerce and Industry has been working as a catalyst for the promotion of Indian industry, trade and entrepreneurship for the past 116 years. It is a forward-looking, proactive and dynamic pan-India apex organization. We at PhD Chambers have an Ayush committee, and we are committed to the promotion of Unani, Ayurveda and Ayush system of medicines. The World Unani Day is a global event which takes place every year on February 11th on the occasion of the birthday of great Unani scholar and social reformer Hakim Ajwal Khan Sahib. The main aim of the Unani Day and international conference is to spread awareness and sensitize the population about Unani system of medicines. It's preventive and curative. As per today's theme of the conference, diet and nutrition have been known for many years to play a key role in maintaining good health. What is apparent at the global level is that great changes have swept the entire world since the second half of the 20th century, inducing major modifications in diet and nutrition. First in the developed world and more recently in the developing countries. During the past decade, rapid expansion in a number of relevant scientific fields, and in particular, the population-based epidemiological evidence has helped to clarify the role of diet in preventing and controlling morbidity and premature mortality resulting from NCDs. Some of the specific dietary components that increase the probability of occurrence of these diseases in individuals and interventions to modify the impact have also been identified. Furthermore, rapid changes in diets, nutrition, and lifestyles that have occurred with the industrialization, urbanization, economic development, and market globalization have accelerated over the past decade. Healthy and nutritious diet are a must to prevent disease. Dietotherapy seeks to restore the imbalance in the body due to errant lifestyles. Unani system of medicine lays rules for a balanced lifestyle which revolves around 6 essential factors. Non-compliance with these principles leads to an errant lifestyle and ultimately leads to disease. Diet is an important component of these essential factors. The Unani system of medicine believes that a physician is not only healer, but an assistant to nature tabiyat of the body, which is the true healer. Hence, the diet should be in accordance with it. Diets have been mentioned according to various stages of life to maintain the digestive system at its best. The Unani system of medicine has a long and impressive record in India. Unani system of medicine is endowed with enormous single and compound drugs and regimes for the management of obesity and diet that are safe and highly effective. It offers treatment of diseases related to all the systems and organs of the body. The treatments for chronic ailments and diseases of skin, liver, musculoskeletal and reproductive systems, immunological and lifestyle disorders have been found to be highly effective and acceptable worldwide because of its easy availability, cheaper and relatively safer than other conventional medicine. The current challenge to healthcare providers is to manage the overwhelming amount of information in the areas of nutrition, related research, and product information. Another is to provide accurate, up-to-date education to help people to understand the personal roles, assume responsibilities for their own wellness, and obtain adequate information to do so. Managing nutrition information and changes in information disbursement is an integral part of managing the patient. There is a need to increase the exposure of healthcare professionals to clinical nutrition concepts in basic and graduate training as well as in continuing education. Students should be required to demonstrate the knowledge of nutrition and nutrition education methods by responding correctly to test questions on diet and health. Further, in medical schools, nutrition can be made part of the curriculum in all clinical areas. When nutrition is made an integral part of the broader program of preventive medicine, it is more likely to be accepted and maintained. Moreover, healthcare practitioners should be encouraged to use the professional skills of registered dietitians and others with nutrition expertise in educating, motivating, and assessing the nutritional status of patients. I would like to share that the company I represent, Multani Pharmaceutical Limited, was established in 1938 by my grandfather in Lahore, undivided India, and then carried forward by my father, myself, and my sons. We are continuing the same. We are 4th generation. We manufacture Ayurvedic and Unani medicines in a WHO GMP certified plant at Haridwar and are committed to promote the Unani and Ayurveda system of medicines. Before winding up, I would like to just share with you an experience which happened with me recently. I went for a routine health checkup and my sugar level was found to be 6.6. The range for being declared a diabetic is 4.4 to 6.5. I'm talking about glycosylated hemoglobin, HbA1c. So mine came out to be 6.6. Now with that, we all know that diabetes is a silent killer and causes a lot of grief and pain to the patient. And of course, I consulted some doctors, including my elder brother who's a cardiologist practicing in USA, and I was asked to immediately start off on allopathic drugs to control the diabetes. I requested him, give me 3 months time. Let me discuss with all my Hakims and Vaids in my premises, in my company. And let me inform you that in 3 months time, my team of Vaids and Hakims, they gave me a diet and they asked me to follow a diet and gave me a nutritious, whatever I have to eat. And within 3 months, my sugar level came down to 5.9. The range for sugar is, again, I say 4.4 to 6.5. And I was saved by our Unani system from being dependent on allopathic drugs for the rest of my life. Our Unani medicines and Ayurvedic medicines have great strength. And of course, diet and nutrition are a must, which if we follow them, we will never fall sick. I thank Professor Asam Ali Khan Sahib, DG, CCRM, and all organizers for their dedication and hard work to take our Unani system of medicines to greater heights. I wish I had been informed well in advance ताकि हम लोग भी जन्नत में आ सकते थे श्रीनगर. Thank you. May Allah bless us all.
Thank you, Shri Pradeep Multani ji. Thanks for your informative point of view. In fact, you said that non-compliance of 6 principles in Unani medicines lead to a disease state, and we need to be accurate and up to date. We need to provide update and accurate education to all. Thank you very much. Now, since we have already surpassed our time, and we have, we are having a very limited time with us, and all of you have been very patiently since morning with us. I would request all the panelists to limit their the observations only for 4 to 5 minutes only, because there is a good number of the panelists, those who are supposed to speak. Now I have the honor to request Dr. W. Selvamurthy, President, Amity Science Technology and Innovation Foundation, and Director General, Amity Directorate of Science and Innovation, Noida. Dr. Selvamurthy, please go ahead. But kindly, you please unmute yourself, sir. Try to finish up in 4 or 5 minutes. Thank you.
Thank you, Mr. Chair. First of all, let me greet all the people who practice, who preach, who also do research and promote Unani medicine on this Unani Day celebration. My salutation to all Hakims and all those who are manufacturing these drugs and taking care of the humanity through the Unani medicine. And in the Unani medicine, I must also put on record our deep appreciation to Professor Asim Ali Khan, who is the DG CCREM, for this great initiative, and he is globally spearheading this mission of spreading this knowledge of Unani system of medicine across the globe. Compliments to you, Professor Asim Ali Khan. See, there is a saying in Tamil that there is no need for medicine if we eat the right diet at the right time. That means when you are hungry, eat to your appetite. And then once it is digested, then you go for the next meal. So if you take the right kind of food and this type of practice, you don't need medicine for your life. You will live 100 years definitely. So this is the saying in Tamil. So it's also true in all traditional systems of medicine. They are focused on diet and nutrition, which has got both prophylactic and promotive and curative aspects. So all the 3 dimensions are there for diet and nutrition. It can prevent disease, it can promote your best of your physical and cognitive abilities, and also it can cure disease as a supplement to your medication, including Unani system of medicine. So this, there are many diseases, say hypertension, coronary heart disease, diabetes, obesity, rheumatoid arthritis. There are many diseases which is closely linked with the dietary imbalance, like hyperlipidemia leading to coronary heart disease, increased sodium intake leading to hypertension. So there are many examples of this lifestyle where the nutrition plays a very important role. Unani system, which is a very ancient system, knowledge, wisdom of our country, and which in 460 BC started in our country. And then you have the basic humors. There are 4 humors which Unani medicine system talks about. One is the blood, phlegm, bile, both black as well as the yellow bile. So the whole nutrition is the raw material for all these humors to start with. So that is how it influences the health, because the humors play a very important role in maintaining your health. Then in Unani system of medicine, when you are talking about diet, it also talk about Prakriti, that is in Ayurveda as well as Unani. One looks at the personality profile, Vata, Pitta, Kapha, based on which you prescribe medicine. Certain diets are restricted during when you are taking Unani medicine. And the food and drink, out of the 6 which he mentioned, the previous speaker, the al-makul, ba al-mashroom, that is food and drink, food and liquid, which is very important. Al-makul, Baal mushroom. This is what is the actual name they have given for this type of food and diet, which is an important role in Unani medicine. Fasting is also prescribed in all our traditional system, including Unani medicine. In this Unani medicine, they call it as Tarke Gaiza, which is the fasting, and also restriction, dietary restriction. They talk about Taklil Wul Giza. That is, certain diets are to be restricted depending on your disease or the personality or your health condition. So, like this, diet has been in the Unani system of medicine a very important component of the practice itself. When you talk of this Unani substances, you can put it into 6 categories. One is Giza, the diet-related substances in Unani medicine. Then Gizai Dabai, that means nutraceuticals, nutritive elements as medicine, nutraceuticals. Then we have Dabai Gizi, that is medicine having the nutritive values. So this is also another category of substances. Then we have Dawa, that is Unani medicine per se. Then we have certain poisons in low concentration, which is known as samyas. So these are the 6 major categories of Unani medicine systems, which will fall into any one of this. So this is in the diet is very, very important component. Then in Amity University, which I belong to, and Dr. Asim Ali Khan has, with his support and blessings, we have been able to carry out a research on anti-cancer potential of Dawaul Hurkum. Dawaul Hurkum, it's an anti-cancer properties we are establishing on the hepatic carcinoma, hepatocellular carcinoma. We have the cell lines, liver cell lines, based on which we are looking at how does this molecular docking of the herbal component of this drug, Dawawul Kurkum, how does it dock with this and bring about the anti-cancer properties? So we need such kind of research as well when you are looking at global presence, expanding our global presence of Unani medicine. We need to look at and put them on a scientific pedestal. So we are carrying out in Amity University from CCREM sanctioned projects. This is one of them. Now, finally, to give the message, to concluding message, advantage India. Today, Unani medicine, if India has to assume leadership role, we have great advantage. What are those? One is we have a strong root of Unani medicine in the country. 460 BC, we started. Then Hakims, we have a large number of Hakims who are already practicing Unani system of medicine. We have rich biodiversity of herbo-mineral compositions which is available today. That's the advantage India. Then we have CCREM under Ministry of Ayush, headed by such a leader, Professor Asim Ali Khan. Then we have Prime Minister himself is giving patronage and support to Ayush system, including Unani. Then, so with this, can't we become a leader at the global level for Unani system of medicine? We will. So what we need to do is create this awareness, spread this awareness across the globe, and also create a movement for Unani system of medicine by bringing the scientific and philosophical and artistic method of practice of the system of medicine. So if it happens, India certainly will assume a leadership role in this Unani system of medicine. Once again, my congratulations to Professor Asim Ali Khan and all the panelists who have joined us today. I am very eager to listen to all your knowledge, experience, expertise, and wisdom in this field. Thank you so much, Professor Asim Ali Khan, and also the chair for this session.
Thank you, Dr. W. Silva Murthy. Thank you for your wonderful observations. And you rightly said that the right kind of the food saves you from taking the medicines in future. And we also understand a stitch in time saves 9. And if we take the right kind of the food at this point of time, we will be, making ourselves disease free. And he also spoke about the Unani system of medicine being preventive and curative, and in comparison to the other kinds of the medicines where we are treating the symptoms of the problem. And he also spoke about ilm al-ghiza, which is one of the important arenas of one of the important parameters of the Unani system of medicine. Thank you very much, sir. Now, I have the honor to request Dr. S. Farooq, President, Himalaya Drug Company, New Delhi. Dr. Farooq Saab, please have your point of view.
Assalamu alaikum, adab, namaste sabko, good afternoon. It is my proud privilege to be here today, and definitely the topic given is very important. Ghiza and treatment with the knowledge of food. And we all know this, that today the different diets are in use today, like paleo diet, which is Stone Age diet, then medieval diet, then keto diet, Atkins diet. These all diets are there. But in the Unani system of medicine, like Dr. Saab has just told about Kitabul Ghiza and Kitabul Ma'ushir. So these in Ayurveda also, Khan Pan, that is there. So there is a great sense of diet in the medical system of health. Today, doctors also, nutritionists, then slimming diets, dietitians, these people also talk about the diet system. And the diet has a very important role. And our system of diet in India, that itself is having a lot of content of medicines in it. The herbs which we use are having a lot of content of medicine in it. And there is a old poetry on हुआ शाफी, which says जहाँ तक काम चलता हो ग़िज़ा से, वहाँ तक चाहिए बचना दवा से. जो हो महसूस मैदे में गर्मी, तो चख ले सौंफ या अदरक का पानी. Similarly, like this diet is there, similarly water also is there. So barley water and these waters are being described. And in Khan Pan, the medicine also with which thing you have to eat, that is also there. Then similarly, faqa is also there. There is a couplet, जो बदहज़मी में तू चाहे फाका, तो फाक फला या कर दो वक्त फाका. So these are the things which help in nutrition, and many things in nutrition now. Nutraceuticals are there. That is also food and medicine. Food as medicine. This term was coined in 1980 or something. So there is a great deal of food and short of time. So I'll just say that I congratulate, and it is a very good topic. People should discuss in length small things which we can take in diet, like mooli is very good for piles, cucumber is very good for kidney, and haldi and adrak and all these things are having beautiful results when we take these things in our diet. So my good wishes and thank you very much, and thank you, Dr. Asim, and with these words I conclude that we have to practice it. Thank you.
Thank you, Dr. S. Farooq Saab. You rightly said that, taking healthy food is key to remain healthy and disease-free. And you also spoke about that time has come when we will have to let the food be the actual medicine. In fact, and thank you very much for your kind words and for your blessed words.
One thing I may correct that it is Himalaya Wellness Company. Our chairman is Mr. Manal, and now it is Himalaya Drug Company is now changed to Himalaya Wellness Company. Thank you
Okay,
for.
okay, sir. Himalaya Wellness Company. Thank you, sir. Thank you so much.
Thank you.
Now I have the honor to request Professor K.M.Y. Amin, Professor in Pharmacology from Aligarh Muslim University, Aligarh. Professor K.M.Y. Amin Saab. Has he joined us? Okay. I would request Honorable Vice Chancellor, University of Kashmir, Professor Talat Saab, to kindly present his point of view, and I request Professor Talat Saab to bless us with his words of wisdom.
Thank you so much. It is good to see many of the people like Farooq Saab, with whom I have been in touch when I was in Jamia, and also I'm going to be more in touch with him when I go back to Dehradun, and then obviously a professor from Amethi University and many others. As people have been talking, that it is always better to have controlled diet so that you avoid medicines as much as possible. Even in our own religion and other religions also, it is always said that आपको जितनी भूख लगी हो उससे थोड़ा कम खाइए तो आपको वो प्रॉब्लम नहीं आएगी इस तरह and then obviously people talked about fasting. Fasting, even I was reading somewhere that it is there in Islam and also in Hinduism that fasting one should do, which has lots of very important aspects, for wellness. And I was also seeing some of the scientific news in which one of the Japanese have said that they did research, I don't remember which university, and they said that if at least for 30 days one should fast, and that will be very good in a year if you do 30 days of fasting. But he doesn't say that you have to do once for 30 days, you can do in batches or whatever. So that is another important aspect that one needs to practice. And I'm sure that this sort of things, and obviously, as I said during my morning session when I was speaking, that we have this tradition, and then I was very proud when I was in Jamia Millia to start this center in the name of Hakim Ajmal Khan Sahab. And they had also started basic teaching as well as research. So it is very, very important that the Unani medicine, like what we are already doing in Kashmir University and many other places, and then I also know I have been visiting their center in Hyderabad, which is very, very good center. So the thing is, whatever, see, this is very, very important and old system of medicine which needs to be modernized by joining hand with universities and other institutions where people are working on different aspects like biotechnology and biochemistry, molecular biology, and then also see that how things work in your body. And I'm sure it must be already happening, but I would request all the people in the universities and also places like CCRUM to get in touch with the universities in your neighborhood. For example, we know in Kashmir there are lots of colon cancer and many other type of cancer. Actually, I was surprised to know that one of the biggest population in terms of the total population, Kashmir has one of the highest number of cancer, for example. Okay, although We said that एक साहब कह रहे थे कि हमें जन्नत अभी मत जाइए, आप जिंदा रहिए, पर आप घूमने के लिए कश्मीर आइए. जन्नत जब जाता है आदमी जब वो मर जाए, इसलिए it is better to be very careful. But at the same time, जो लोकल डिजीजेस हैं उनको भी आप ट्रेडिशनल मेडिसिन के लिहाज से और उनकी फिर आप हम लोग कश्मीर यूनिवर्सिटी में ऑलरेडी इस तरह के कुछ काम करवा रहे हैं जहाँ पे हमारे जो ये स्किम्स के वहाँ के कलीग्स और यहाँ के लोग मिलके उसी तरह से बहुत सारे लोकल इश्यूज जिसको बाहर के लोग नहीं आके अटेंड कर सकते हैं, one should try to do. So I am very sure that if this sort of things happen, and we will be very happy to support anything that such things are happening in Kashmir or in our own university and other institutions which are doing this traditional medicine to come and work with us or have collaboration with us. So I'm very sure there will be much better speaker who will know more about these medicines and diet and all. Because मैं खुद ही उन्हीं लोगों को follow करता हूँ, and it's okay. I mean, somehow still I'm surviving, maybe because of the doctors and the medicines and on the system. Okay, so one has to be careful for their health and also well-being, and at the same time try to use as much as possible the natural way of living, doing exercises, walking. So things will be much better rather than having all this sort of present diabetes and other things which can be avoided to a large extent. So I thank you very much. खास करके मैं असीम साहब को और अकबर मसूद साहब को और हमारी सीमा जी और सारे पैनलिस्ट को मैं मुबारकबाद भी देता हूं और मैं वेलकम करता हूं. कश्मीर आप आइए और आकर के यहाँ पे आप अपनी रिसर्च करें, आप यहाँ पे इंटरेक्ट करें. We will be very happy to give any support from the Kashmir University. Thank you so much. अनम्यूट कीजिए भाई. Dalgal Saab, I can't listen.
Thank you. Am I audible to you, sir? Am I audible to you? Okay.
Yes, now.
Thank you so much, sir. Sir, you were dot on target in saying that since morning we have been speaking that there are problems on the overweight as well as the underweight, malnutritions. They are the problems, they are the stated problems, and much of the work is being done over there. And you rightly pointed out that there is a study wherein it has been pointed out that the fasting of 30 days in a year is a curative practice, and it's an important segment for the wellness. And thank you very much for pointing out that we need to integrate different sciences for putting out their efforts into the research. Further research and further collaborations between different institutions is also required, and between different systems of medicines is also required in order to make this nutraceuticals and the food and the nutrition as an important factor, important regimen, an important requirement for treatment protocols. Thank you very much, sir. So now I have the honor to request Dr. Santosh Joshi ji, who will be speaking on behalf of the representing Dr. Asad Mueed Saab, who is the Executive Director, Hamdard Laboratories Medicine Division. Thank you very much. Dr. Santosh Joshi ji, are you there?
Thank you, sir. Am I audible?
Yes, you are audible now.
Yeah, thank you.
Please go ahead.
Good afternoon, good wishes to all on the occasion of Unani Day celebrations, which we are celebrating on birth anniversary of great Hakim Ajmal Khan Sahab. I am representing Hamdard Laboratories India, which is a premier institution of Unani and the leader in Unani industries. I extend my respect to moderators, Honorable Professor Asim Ali Khan Sahab, Director General CCRUM, Ministry of Ayush, Honorable Professor Akbar Masood Sahab, Vice Chancellor, Baba Gulam Shah Badshah University, Rajouri, Jammu and Kashmir, Honorable Professor Muhammad Afzal Sahab, Registrar, Central University of Kashmir, respected panelists and all participants. Today's topic is very relevant as after COVID-19 pandemic, we all become very much concerned about our health, and especially all of us become more cautious for preventive measures and maintaining immunity through proper diet and nutrition. India faced all the three waves of pandemic effectively, and we all have witnessed how our traditional knowledge of Unani system has played a significant role for boosting the immunity and fighting the pandemic. It has once again proved how our 1,000 years of faith on traditional medicine has helped us to combat the unexpected health challenges. We all know that diet is the top risk factor in the global burden of diseases. Nutrition and health are very closely linked. Poor health results in poor nutrition outcomes, and poor nutrition results in poor health outcome. It was well described by Hippocrates, also known as father of medicine, who has stated that let your food be your medicine and medicine be your food. Based on same principle in Unani system of medicine, prevention of a disease is having same importance as curing of a disease. It is the reason importance of the need for keeping water, food and air free from contaminants is considered very important in our Unani system. The 6 essential prerequisites, as stated by other speakers too, for promotion of health and prevention of disease are well defined in Unani system as air, food and drinks, bodily movement and repose, psychic movement and repose, sleep and wakefulness, evacuation and retention. So we can see food is a very important factor for maintaining good health. Dietotherapy, which is known as Ilaj bil Giza in Unani, is a concept of Unani system which emphasizes that food plays a key role, and it is well studied and documented that by regulating quality and quantity of food, several health issues can be treated. There are several published documents in our Unani system which deals with subject of diet in relation to specific diseases. Certain foods are considered as diuretic, laxative, cardioprotective, anti-diabetic, aphrodisiac, and for liver health and for several health issues. Today's major health-related problems, whether acute or chronic conditions, they are mostly related to poor nutrition or overconsumption of food. A large proportion of coronary diseases and cancer can be attributed to unhealthy food habits. We all know that proteins, carbohydrates, fats, vitamins, and minerals are the essential nutrients required for maintaining our normal health and for our growth. It is a fact that there are 8 amino acids which our body cannot produce. Similarly, the water soluble vitamins, B complex, and vitamin C cannot be stored in body and must be consumed daily to replenish our body requirements. It is just an example to realize how the proper nutrition is important for all. Dietary modifications is the first step in the fight against the high cholesterol levels that contribute to heart disease and atherosclerosis. Low cholesterol diets are prescribed to reduce the risk of heart disease and to treat diabetes, and also for high blood pressure. Reduced amount of salt, as already we discussed, in the diet is an important factor for those patients who are suffering from high blood pressure. In line with such concepts, in Drugs and Cosmetic Act, in Rule 158B, in Patent and Proprietary Medicine Section 3H, there is a specific category for Mukavi or positive health promoter formulations, which are recommended for promotional and preventive health. Finally, I would like to express that current situation presents a right time for Unani concepts to become even more popular globally. The world is realizing how modern and traditional medicines both are important for wellness of mankind. There is a growing interest towards Unani system of medicine, and people are realizing the benefits of Unani concepts and its role in boosting immunity through positive health promoters formulations. We all are committed for contributing in India's growth story, especially on health front, through unique and proven Unani system. Once again, thanks to all participants, CCRM team and Ayush Ministry on behalf of Hamdard Laboratories India, I wish all success to Unani Day celebrations, which will be beneficial to all stakeholders, whether it is academia, industry, or government bodies. We all will get benefited from this technology related sessions. Thank you. Thanks a lot.
Thank you, Dr. Santosh Joshi ji. You rightly said that let food be the medicine and medicine be the food. And you also said that the contamination, we have to prevent the contamination of the water and food and air in order to remain healthy and safe. And you also linked the diet directly with many kinds of the disorders, diseases like chronic diseases, which are congestive heart failures, as well as fatty liver. We all know low cholesterol. We all know that, this cardiac diseases, they are also having a direct ramifications and direct linkages with the diet. Thank you very much. Now, may I request Dr. M.A. Waheed, member governing board, CCRUM New Delhi, to kindly join us. He is probably joining us online and bless us with his words. Dr. Yusuf, he's not there? Dr. Waheed? Dr. Waheed, please unmute yourself.
I'm audible now? Hello?
Yes, you are audible, sir.
Respected Chairman and my dear colleagues, as a panelist and the participant into this international conference on diet and nutrition. As all of us know, this for the last 2 years around the situation post-COVID, which made us to work from home and this mostly adopted this lifestyle has resulted into the nutritional challenges and undernutrition across the globe for the humankind. As we all know that there are a lot of emerging problems with regard to the nutritional diet for the last 2 years. Now the point is, let us go to little insight about disease and nutrition relation. As per the WHO, they state that the disease definition given by the World Health Organization is the state of the complete physical, mental, social well-being, and not merely the absence of disease infirmity. But further, the WHO has revised the definition, revising that the extent to which an individual or group is able to realize the aspiration and satisfy needs and to change or cope up with the environment. At the same time, cope with the environment and manage with the disease conditions which takes place into the metabolic activity into the body. So through the diet, Unani medicine is a great advocate of the Unani system of medicine. The many references, the entire literature has the references about the role of diet in the management of the different disease conditions. For my viewers, I just wanted to tell that, as we all know that the whole grain, fruits and vegetables contains the part of the diet. And the nutrition is the process of taking food and using it for the growth of metabolism and repair. This is the point. This is the point which we have more focused into the literature of the United System of Medicine. I'll give a very small example. In the cases of neurological disorder, where Unani has greater role to offer, like the hemiplegia, paraplegia, monoplegia, and peripheral neuritis, and other cognitive diseases as well. So there's a small concept of before starting the drug, real treatment, before trying to, going for a line of management, the first choice is give a small fasting and give a honey water for a few days. That resulted into the help the biological system to improve and curb the disease process. And Unani system of medicine is a great advocate of the role of diet and the nutrition in the management of the diseases. So keeping fast for a few days initially before really tackling the disease conditions and giving a less nutritional diet for some time to help the tabiyat or the physics, natural physics, which is the natural, according to Unani system of medicine, which is a natural physician to combat the diseases. And the same theory of autophagy, all of us know that fasting for health and longevity was proved by Japanese cell biologist Yoshinori Osomi, which has got a Nobel Prize. As we know that the intermittent fasting or intermittent giving a diet according to the disease condition and the patient condition, keeping the nutritional, looking into nutritional factors. And at the same time, when we take the food, it gets metabolized in the body. What happens into the body? There's an entire essence of the metabolism has been discussed in the United System of Medicine. As we all know, the role of the catabolism and anabolism, where the breaking of the food into the energy and using this energy for the building of the cells. So these both the pathways are being done with the help of the food which we take. And these food, when we take this metabolism, all this metabolic end activity of the metabolism will lead to the immunomodulation in the system. And immunomodulation will definitely need, based on the theory of Hamer's, that is a misage. It fixes of the, like for example, the basal metabolic rate, the BMR of a person, how active the person is, how sedentary life of the person impact the disease or the activity of a person. So these are the conditions may lead to certain disorders. They say, for example, I will tell you the few examples of that. The most common examples I will give you, the metabolic syndrome is because of the sedentary lifestyle, where there is a chronic, there's a pre-diabetic or diabetic stage, which leads to the cluster of components like obesity, hypertension, lipid dyslipidemia. So that will lead to the many other underlying conditions. So could be a chronic inflammation, chronic infections, the increased free radical productions, hypertension, or endothelial dysfunctions, so which will relate to the cardiac dysfunction. Insulin resistance is a big condition on obesity. Insulin resistance is a big condition where insulin is insulin is able, but it is not taken up by the cells to reduce the blood sugar levels in cells. So now these conditions can also have the social, psychological, and economical impact on the exchequer of a country globally. So that will lead to the loss of productivity, increase the direct and indirect health expenditures, the turn into the poor quality of a person, and sometimes lead to the possible permanent disability. So these complications can be a microvascular, neuropathy, or sometimes lead to the infections too. So what we need to do is we need to have a better control on a diet, a better control on diabetes, better control on obesity, better control on hypertension, better control on cardiovascular complications, better control to the neurological disorders. So better complications translate to the fewer complications translate to the fewer days of loss of absentees from the work. So translate into the good social and economical improvement, and the disability and the future savings of the healthcare expenditure too. So these cluster of components which are related with the diabetes and with other diseases are called as a metabolic syndrome, which is very common. So World Health Organization has given a alarming to the in the subcontinent. Adolescence ages are children of the pre-adolescence and adolescence ages are prone to develop the obesity because of the diet, because of the sedentary lifestyle, and pre-diabetes and diabetic related cardiovascular complications. In that way, what we need to do is, there are many dietary substances or dietary articles which have had a greater role in combating such conditions. Before that, really, I just wanted to mention that the immunomodulation has to be done with this. A coin word was given in Unani medicine that Dawai Rizai or Rizai Dawai. There are certain food articles which has the nutritional value as well as medicinal properties, and the Rizai Dawai and Dawai Rizai is medicinal properties which has a nutrition too. So sir, those are all indicated. I'll give a few examples of that. Before that, I wanted to give you this is a coin word of Rizai Dawai, and the same coin word has been developed by the nutraceutical, which was in 1989 by Stephen DeFelice. So that was given, which is not really approved by the World Health Organization, US FDA, but US FDA has given it permission
Dr.
to
Wahid
have
Saab,
a
am I audible
functional
to
foods.
you? Dr. Wahid
Yes,
Saab,
yes.
please conclude in 1 minute only.
Okay, so I'll give you, there are certain fruits like jamun, amla, ginger. These are the food, part of the food supplements which have a greater role in the combating the many neurological disorders or metabolic disorders into the body, like obesity, pre-diabetes, cardiovascular complications, and neuropathy. So this is the time to highlight this and probably take the advantage and collaboration with the various institutions in order to create the really evidence-based data in combating the disease by the use of the food and the nutrition as per the principles of the United System of Medicine. Thank you.
Thank you, Dr. Wahid Saab. You rightly pointed out that Unani is a great advocate of the role of the diet, and you also groped into the biochemical events and as well as immunomodulatory events of the various dietary and nutritive materials. Thank you very much. Now, may I request Professor K.M.Y. Amin, Professor in Pharmacology, retired Professor in Pharmacology from Aligarh Muslim University. Kindly note, sir, that I request you to come over and kindly note, just please conclude in 3 to 4 or 5 minutes. Your gross points only. Please unmute. Okay. Please unmute. Is he there? आवाज नहीं आ रही आवाज नहीं आ रही आपकी अनम्यूट कर लीजिए अनम्यूट को there is some technical error. Till the technical error is resolved, I will request Dr. Mohan Singh ji. Okay. Now I request Professor M.C. Sharma Saab to kindly put forth his point of view. Within 3, 4, 5 minutes.
Okay. Namaskar to all of you. First thing is that I am not a scholar of Unani medicine. I am a student of Ayurveda. Second thing is I practice a lot of medicines of Unani origin in my day-to-day practice. I know that efficacy of Khamira, Ushabba, Khamira, Mazum, Lauk, Habbe, Ark, Sharbat, and once a time before 20 years, I use some medicines of animal origin, Reg Mahi, Zundabedastar, Bir Bahuti, etc. in my practice. Well, now I talk only for a few points only. That is incompatibility of the food. The food is good for health, everybody know. But when is incompatibility, like radish with milk, milk with salt, milk with fish, milk with any sort things, खट्टी चीज़ों के साथ दूध नहीं, ये सब these are the cause of autoimmune disorders. So therefore we must aware about these things, that the compatibility, there is a lot of compatibility and incompatibility of food in Ayurveda. So therefore we know it, that the regular use of this type of food can be cause of autoimmune disorders. I have observed like leukoderma, vitiligo is one prominent cause of vitiligo is incompatibility of food. Second thing, only I will talk for the food of children. we know that this is the history of here in Kashmir before 2000 years, when a person was a very, very intelligent and his words not recognized by the scholars also, then a physician told them that put him stand in a lake and give to eat curd and boiled udad. सो देयरफॉर आफ्टर 1 मंथ, 1 महीना तक उसको तालाब में खड़ा करके दही और उड़द खिलाया तो उसकी बुद्धि का ग्राफ नीचे आ गया। और उसके बाद ये बिल्कुल पक्का हो गया कि सुबह सुबह अगर आप दही और उड़द खिलाएंगे बच्चे को ख़ास तौर से, तो उसका मेमोरी कम हो जाएगी। और वैसे भी सुबह के टाइम पे दही बच्चे को खिलाना उसका IQ डाउन कर देता है, क्योंकि दही को मंद कहा है, धीमे काम करने वाला। तो किस समय क्या खाना चाहिए और किस समय क्या नहीं खाना चाहिए, ये बहुत ज़रूरी चीज़ है। तो दूसरी बात यह है कि ये देखना चाहिए कि दही को कब खाना चाहिए और कौन से आयु में ज़्यादा खाना चाहिए, ये, और दूध कब खाना चाहिए। जैसे कि दूध शाम को ही लेना चाहिए, सुबह दूध लेने से कफ के रोग बढ़ जाएंगे। तो ये जो भोजन के एस्पेक्ट है, डाइट के एस्पेक्ट है, ये बहुत इम्पोर्टेंट है। और तीसरी बहुत छोटी सी चीज़ कहना चाहता हूँ कि ये बहुत ज़रूरी है कि आप लोकल फूड पे डिपेंडेंसी रखें। नाउ ड्यू टू ट्रांसपोर्टेशन वी कैन हैव फॉर ऑल द फूड्स वेयर आर अवेलेबल इन द वर्ल्ड, नॉट इन इंडिया, इन द वर्ल्ड, but they are not good for health. For according to time, ऋतु के अनुसार खाना चाहिए। अगर आप गर्मी के अंदर गर्म चीज़ खाएंगे तो वो नुकसान करेगी। पैसा है तो गर्म चीज़, जैसे कि मैं देखता हूँ हमारे जयपुर के अंदर जब गर्मी के अंदर मूली मिल जाती है, तो वो गर्मी में मूली खाना कोई फ़ायदे की चीज़ नहीं, क्योंकि मूली गर्म होती है, उसकी तासीर गर्म है। तो वो अगर आप गर्मी में खाएंगे तो नुकसान करती है। तो ये कुछ चीज़ें हैं, ये इतनी लंबा चौड़ा है। फिर फूड अकॉर्डिंग टू डिजीज़, डायबिटीज़ के पेशेंट को क्या फूड खिलाना चाहिए, ओबेसिटी वाले को क्या खिलाना चाहिए, और जो मेहनत करने वाले हैं, जो दिमाग से काम करने वाले हैं, उनको क्या फूड खिलाना चाहिए, ये सारा कंसिड्रेशन हमारे यहाँ किया हुआ है। बहुत ज़्यादा समय नहीं लूँगा। आई एम वेरी थैंकफुल टू द DGCCRUM and the organizers to call me here and to join my thoughts with you. Thank you very much.
Thank you, Professor Sharma Saab. These were kind words. These were kind words. And you have rightly pointed out that there is a right kind of combination of foods required. And we often in Kashmiri also says that you cannot take you cannot take milk with the fish. And you also said about certain drugs, about certain foods for the children and how they are affecting. And this is the traditional kinds of the things and that we have been listening to, and they are definitely having an adverse impact. Thank you, sir. Sir. We may take the question answers later. Now, Professor K.M.Y. Amin Saab, please join us now.
Thank you very much. The Unani recommendations for diet for promoting health and preventing disease are really remarkable. And the proof is that they are very popular. And they are very comprehensive. Unani has something to say about every type of food, and it is able to relate it to every type of person, in every type of season, in every type of age group. So this remarkable comprehensiveness and systematization in Unani dietary recommendations depends upon its very unique system of 4 qualities of hot, cold, dry and wet. So all the foods, they can be described in terms of these 4 qualities, whether the hot is dominant or the dry is dominant, and then it can be correlated with the person, depending upon the quality which is dominant in the person, whether hot is dominant or cold is dominant. And the quality of the person is also gauged dynamically, not statically. In different seasons, the quality of the person will change because of the quality of the season. In different age groups, also the same will happen. So this is the remarkable power of Unani medicine. That is its principles of 4 basic qualities or kafiyat of hot, cold, and dry and wet, by which we can describe every food, by which we can describe every human being in every perspective, in every dimension, in every situation. And so then there is a tremendous boost to health on taking the food. Now coming to the principles, which type of quality should be taken? If a person is hot, then whether hot food will promote his health or cold food, opposite quality will promote the health. So Unani medicine presents the principle that basically the same quality will promote the person's health, a man or woman's health. If a man or woman is hot, then hot food will promote his health. If he is cold, then cold food will promote his health. However, it qualifies this basic principle by saying that certain qualities can be harmful if their degree increases beyond a particular limit. For instance, the hot quality. And so the basic principle of using a hot food for a hot person has to be qualified by decreasing the hotness a little bit. Otherwise, the extreme hot will harm, because hot harms, the cold does not harm. Similarly, the dry harms, the wet does not harm. So this is a secondary qualification which Unani medicine makes. And so on the basis of matching these 4 qualities between the food and the person, putting the person in various perspectives. So this is the very powerful scheme of Unani medicine, which is responsible for its tremendous impact, which has made Unani dietary recommendations very popular. It has seeped into our popular culture, into villages, among the backwaters, everywhere. The Unani principles of dietary regulation are followed throughout the length and breadth of the subcontinent. The second point to be noted is that Unani medicine does not only give the principles, which are tremendous, I have just explained. It gives certain short lists of particular recommendations also, because it's not possible for common persons to apply principles to various foods and then they apply the principle to themselves and then to determine which type of food they should have. So along with giving these tremendous principles by which we can correlate every type of food with every type of human being in every type of situation, along with this, Unani medicine also gives short lists of very salient recommendations. For instance, it says that among the fruit, fig, injir, is the most nutritious fruit. And this is followed by grapes and date. However, date will be useful in the areas where people are used to having dates, not in the areas where they are not used to having dates. So in this way, this is a tremendous another quality of Unani medicine, that it gives short lists of particular recommendations which can be memorized, which can be remembered by common people, and they can use them for improving their health, for promoting their health. Now, what has to be done? On the one hand, easily understandable, broad and general guidelines, Unani nutritional guidelines, should be prepared, and they should be put through the print media and through the electronic media to the general masses. And here the focus should be on the particular, most important particular recommendations rather than on the principles. On the second hand, nice monographs and textbooks should be prepared introducing the principles and how to apply those principles for the practitioners of Unani medicine, not only of Unani medicine, but of other traditional medicines and of Western medicine itself. So these are the two things which need to be done. On the one hand, the particular recommendations, the short lists of particular recommendations should be conveyed to the rank and file through print media and electronic media. And on the other hand, monographs introducing the principles and how these principles are to be applied. They should be prepared for use by physicians of not only Unani medicine, but other traditional medicines like Ayurveda and the Western medicine. So I'll just conclude with these few words. Thank you very much.
Thank you, Professor KMY Amin Saab. You rightly said that the prevention is the core component of the Unani system of medicine, and how you have also detailed out various principles and some recommendations also there, okay, how principles of the Unani medicines have to be implemented and followed up. Thank you so much. Now may I request Professor Abdul Wadood Saab, the Director of the National Institute of Unani Medicine, Bangalore.
Respected panelists and participants, Assalamu alaikum, a very good afternoon to all of you. Food is the basic to our existence. Everyone is eager to know about health and fitness and wants to know what to eat, how to eat, when to eat, and how much to eat. And he also wants to be healthy and fit. Sorry. Because a healthy diet not only protects against all types of malnutrition, but also prevents non-communicable diseases like diabetes, heart disease, stroke, and cancers. Unhealthy diet and lack of physical exercise are the major risk factor for global health. When so much knowledge about diet was not among the people, people were healthy because they took healthy foods. But nowadays, in spite of spread of a lot of knowledge about healthy food, healthy diets, and healthy lifestyle, people are diseased because most of the time they are not taking good health. Good diet, healthy diet. Ayush systems of medicine, particularly Unani medicine, has stressed much about the dietary habits by practicing Ilaj with Tadbir. A major chunk of that is Ilaj bil Ghiza. And that's why in Unani medicine, when principles of treatments are discussed, Ilaj with Tadbir, including Ilaj bil Ghiza, that is dietotherapy, is given first priority. Failing which, Ilaj with Dawa, that is pharmacotherapy, and Ilaj bil Yad, that is surgery, are chosen. It means for most, Ilaj with Tadbir and Ilaj bil Ghiza are most important regimens in Unani medicine for treating any disease. According to Unani medicine, replacement to dilution, that is called in Unani medicine Badale Mayat Halal, is that too with healthy food is the best way to remain healthy. Food and drink, makulo mashroob, that is an important part of asbabe sitta zaruriya, that is 6 essential factors of life. Without that, life is not possible. Good health is not possible, has given much importance. Unani medicine has not classified diet simply. It has classified diet in many ways, like according to digestibility, according to quality of chyme, according to nutritive value, according to humors, according to season, according to age, and according to disease, and many other ways the system has classified diet. So it's time to strictly follow the dietary rules given by any traditional systems of medicine or modern system of medicine if a person wants to be healthy. Dr. Joshi very rightly quoted the quote of Hippocrates, food be our medicine and medicine be our food. That is further elaborated Unani system of medicine, Ghizai, Dawai and Dawai Ghizai. There is hardly any drug which is simply a drug, that is called Dawai Mutlaq. All drugs have nutritive value as well as dietary values, nutritive values and medicinal values. This quote of Hippocrates points out towards two things. Let medicine be our food. It may be either we have to eat very less like medicine, and in other words, we have to take a diet which has medicinal value. So at this time, my request is choose Unani medicine for a good health. Once again, I am thankful to the organizers and Professor Asim Ali Khan Sahab to choose a very appropriate topic. Thank you.
Thank you, Professor Abdul Wadud Sahab. You rightly said good diet is directly proportional to the good health, and we have to choose Unani medicine for good health. And I have the honor to request Dr. Mohan Singh, Director ISM, UTJNK, to kindly, put forth his point of views.
Thank you, sir, for giving me this opportunity. First of all, I am thankful to DG Asim Ali Khan Sahab that he has put his best efforts to organize Unani Day along with international conference, and no doubt he is putting efforts for the last 2 months despite problems with his personal life also at his residence home. But due to COVID-19 pandemic, it was not possible on the birthday of Hakim Ajmal Khan Sahab. So it was postponed on 10th and 11th March. So first of all of us are thankful to him that he has made it possible that both the union ministers along with Special Secretary from Ministry of Ayush, Government of India, rather the whole along with Asim Khan Sahab, almost whole government came here, Ministry of Ayush, they came to our place and they saw our enthusiasm, they saw the way we organized, the way we were disciplined, especially Honorable Union Minister was highly impressed what was being seen from his body language. Here the topic of this session or the conference, that diet and nutrition vis-a-vis Unani medicines. No doubt I am not expert in this, but I am habitual that I try to learn more and more from experts. What my previous speakers, sir, has told, Dawai, Gizai, Gizai, Dawai. This Dr. Vahid make me learn one day. And what does it mean? Then I told him that 10 years back I became hypertensive. Then somebody told me I started taking garlic and all allopathic medicines were off and I was all right. So, but I could understand, he explained to me. But this is a wonderful topic because as far as UT of J&K is concerned, we are very good in latest NFHS 5 data. National Family Health Survey data says that we are very good in IMR, NMR, EMR and other health indicators, under 5 mortality, maternal mortality, infant mortality, life expectancy. We are very good in indicators. Rather, among us 4 or 5 states of India, we are competing with them, but we are very bad in anemia and malnutrition. So, keeping this in mind, this topic is very relevant, and especially with regard to Unani. And one day, when Dr. Munjpara Mahendrabhai last time came, Honorable Minister, he had been to Gandharwal also, and he had been to Baramulla also, and he had been to Jammu also. He saw our certain integrative efforts with regard to allopathic system. So he was asking me how it became possible. You know, sir, we tried, it became possible. No, you have not understood the right crux, because he is also a MD doctor, cardiologist, and his wife is a Ayurvedic doctor. He said that these Ayurveda, Unani knows their strengths, but they don't know which area is to be struck, what are the weaker areas of allopathy. And I and you both know what are the weaker areas of allopathy. That is why you have been successful in integrating in these areas. So my request to all of you is this: what I could understand from my experience of 2.5 years here and my NHM experience while working with Ayush doctors. 1 week back, Asim Saab, Raghu Saab was asking me to give me some data with regard to the Ayush doctors manning independently the PHCs. I told him it will not be possible in a day. I will try. You will not believe it, 48 PHCs. I am sure if I would have explored, it would have reached up to 70. 48 PHCs today of J&K are being manned solely by Ayush doctors. So my point here is this, that when I came to know that liver diseases are weaker areas of allopathy, or GI tract, or musculoskeletal diseases, or dermatological diseases, or migraine, or certain sinusitis, or some other diseases. So I try to work in those areas, and especially while when we give chemotherapy in allopathy to a patient in order to maintain his or her health, or by giving some Ayurvedic or Unani medicines which are of having nutritive value, which keep the anorexia away, so that the patient can have better quality life. So if we will be able to integrate these areas into allopathy, to my understanding, except emergency, what I could understand, but I could find that there is no match of Ayurveda and Unani, especially certain sexual problems are being better treated by Unani drugs, certain liver diseases, certain I saw this regimenal therapy is a successful area which we can showcase.
Please conclude, Dr. Mohan Singh ji, please conclude.
But I will conclude. I am concluding that my point is this: if we will focus on diet and nutrition in the UT of J&K, the anemia and malnutrition can be finished, can be improved, and this is the area, topic is very relevant. Thank you. Thanks a lot.
Thank you very much, Dr. Mohan Singh ji. And with this, we come to the end of this session. And in fact, नहीं, मैं इनको बता दूंगा. But I would like to just jot few observations that while discussions were on and while panel discussion was on, I found that nobody talked about the media and the social media, which is having a wide ramification as of now, in order to promote the nutrition and the diet, or the importance of the nutrition and the diet, and this is very important to promote the right kind of the information, because in this hour, we are in this time, we are having the social media which are also promoting the wrong informations. Very difficult to understand which one is the correct kind of the information and which is the wrongful information in this hour when internet is abuzz and loaded with these kind of informations. Another thing, that was very important is that, it has been rightly pointed out that, the the foods, the right kind of the foods at the right point of the time. And it has been observed, and there are studies that, if we are, kicking out these animal proteins right away, it is also involved in number of, reducing number of ailments. And two things I have gone through, wherein it has been found important that the plant proteins, they almost take care of all the proteins that are required, and 8 to 10% more calories, in fact, or if we are totally dependent on the plants. And another thing is that that if we take the whole plants or whole nutrient, we do not individualize the nutrients. What we are doing as of now, we are adding the nutrients, sometimes adding the supplements, adding the nutrients. It has been found that it is also having a deleterious effect on our diets. And the third thing that I would have thought about to inform this August gathering was the corporate influences. As of now, there's a lot of corporate influences on the medicine and the drugs and the pills and the other things, and that's probably the reasons why there is not a unified nutrition research policy. It is being seriously corrupted at the hands of these corporate influences, and this is happening at the expense of the human health. We also need to look onto that counts. Also, corporates have to come out thoroughly in this regard, and researchers have to do a lot on this. So in order to finally, the final word is that in order to combat with the problems and with the issues that are at hand, I will simplify it by saying that we need the armory in our hands. We need G-bombs even in order to neutralize the problems that we are facing. By G-bombs, I mean to say that we need to adhere to the green things. We need to adhere. B means beans, O means onion, M means mushroom, and B means berries, and S means seeds. So we need, when we adopt these kind of the nutrition and the diet in our components, we are definitely going to remain healthy and remain fit. Now, with these words, I would request my other co-panelist, the moderator, Professor Akbar Masood Saab, to have his last word on the event, and then we will hand over the mic to Professor Asim Saab. Thank you.
Thank you, Professor Afzal Sahab. Professor Zargar, I think you have spoken for more than half an hour during the session, so I also deserve more than that time. Anyway, jokes apart. So my time starts now, Afzal Sahab.
Please, sir.
My wife is here. Professor Afzal Sahab is here. So they will bear me that during 5-6 months, I have added few inches towards my belly. And the only difference during this 4-5 months is I became Vice Chancellor. So I used to have long sitting sessions. My diet was the same, except that the long sitting sessions. So not only diet, but your lifestyle also affects your health. My long sitting sessions have increased my sugar level. I have become hypertensive. And now I have realized the culprit and I am trying to control those things. Now everybody talks about nutrition, what is. But nobody understands what is this nutrition and why this is needed. My dear friends, we have to understand what we need and why we need. You see, our body consists of water, about 70% water, proteins, fats, carbohydrates, some micronutrients and blah blah. This is the reason why we need nutrients from outside. Our body is very intricately composed of these. There is a fixed composition. Everything is well controlled. So any imbalance in these things will harm you. One thing, in terms of science, there are certain foods that are needed essentially to maintain your body. There are about, in terms of calories, about 2000 calories for an adult actively working man. And then you have this additional calories for extra expenditure. Maybe Asim Saab will need 2000 calories, I will need 2500 calories. A pregnant woman may need certain more calories. So the requirement varies from one person to another person depending upon the activity that somebody told that health is nutrition, healthy and nutritious diet is essential for good health. Now diet is also a good diet and nutritious diet. There is a difference between. If I take goshtaba, rista and blah 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 blah, I am taking a good diet. But it may not be a nutritious diet. So there should be, one should be very, very clear that what we are taking, is it beneficial for us or it is not. Then it was pointed out that nutrition education is important. Yes, I agree to that. And what I suggest is that in medical colleges, the Department of Biochemistry should be renamed as Department of Biochemistry and Nutrition. So nutrition should be an essential part of the training during both Unani and allopathic. Then somebody pointed out that there should be this drug modification, especially in the Indian system of Unani medicines. Yes, the CCRUM and especially the RRUM has worked immensely on this. There was a drug which was very, very unpalatable with pungent smell. So they modified it, and they modified it to the extent that its efficacy was retained, but it became palatable. So such type of efforts are being made by CCRUM. Now somebody talked about my final word. Somebody talked about the food mixtures or food combinations. Yes, there is a science behind. For example, rice. Rice is deficient of certain amino acids. So if you take plain rice, after some times you will feel deficiency of those amino acids. But if you take this legumes have a very high concentration of those amino acids which are deficient in rice. So if you take a combination of rice with rajma, So it becomes a complete diet. So my moderator, he is not permitting me to continue. So with these words, thank you very much. Thank you. Thank you very much. Thank you very much.
We are all thankful to all the worthy speakers who are the panelists. I am on behalf of the organizers also thankful to all those who are present here, despite we being late. I'm profusely thankful. Just a minute. I am profusely thankful. We are in for one or two questions. If anybody wants to ask anything to Joy, then we will have a vote. Thanks. Yeah, please. Mic hai?
Dr. Ghazala.
Dr. Ghazala,
Send me the mic to the.
any mic?
Please provide the mic.
Or else alternatively you can come over and
नहीं उसको मत बुलाइए उसको मत बुलाइए handheld mics
it's there.
Yes, please go ahead, please go ahead.
It's there.
सर आप बैठे प्लीज.
Please say where is it addressed to also. The question is addressed to.
Sir, with the permission of the galaxy of these guests on the dais and with my worthy directors, I would like to have one submission. So for my knowledge part, we want to know, because the discussion was going on regarding compatibility and incompatibility of food and disease. So no doubt traditionally in Kashmir, we do practice this thing. Everybody says like that our ancestors, our elders, advisors don't take fish with milk or curd with fish. So really, does it really act as a predisposer for vitiligo, or any this research paper has been published on that? So I would like to have this knowledge for that, sir. That is my submission.
No, I have not told that vitiligo is only due to cause of fish and milk. It could be a cause, because till date now the exact cause of vitiligo is not invented. Till date now. So it could be a cause of incompatibility of food, because it creates toxin in our body, and it has been research based that some toxins may be caused due to reduce the copper level of in our blood due to liver. So there is reason that when blood in copper level reduces in blood, the vitiligo comes.
So that means, sir,
that could be caused. This is only this is could be caused, not perfect.
So that means it is really the subject of research, sir.
Yes,
exactly.
Of course,
thank you, sir.
Of course.
I must tell you, I must add here is that there is no. It's not a kind of one gown for the whole town. There is something in the immunology which we say is that there is a host-related things. Host-related things are very important. Like comes March, April, all of us do not have that problems that pollen in reactions to the pollens. What is the reason? When pollen, if this pollen is an antigen, it is antigen for all. But we do not fall prey to the pollen infections. And I think on that front, it's something which is related to the host-related issues also.
Hello.
Thank you. Another question, please.
My name is Dr. Nasir. I'm a leading practitioner in Kashmir in Unani medicine. So my question starts from knowledge advances not by repeating known facts but refuting false dogmas, said Karl Popper. अगर हम सुबह से सेशन को देखें और समझने की कोशिश करें तो बहुत सारी चीज़ों पे जहाँ फोकस देना चाहिए नहीं मिला. उनमें pesticides, use of chemical pesticides in foods, that has not been addressed, or use of chemical preservatives in foods, that too has not been addressed. Then adulteration, then genetic modification of foods, these ये जो grains होते हैं उसके बारे में बात नहीं हुई, प्रोसेस्ड फूड्स के बारे में बात नहीं हुई, फेक फूड्स के बारे में बात नहीं हुई. अच्छा, उसके बाद जो नमक हम यूज़ करते हैं, आयोडाइज्ड नमक, उसमें मेरे ख्याल में कानूनी तौर पर कुछ केमिकल्स को डाला जाता है एज प्रिजर्वेटिव्स, और जब से वो नमक हमने खाना शुरू कर दिया तब से मेटाबॉलिक डिसऑर्डर्स शुरू हो गए। और कई लोगों ने और भी बातें कही हैं। मैं यहाँ पर एक स्टडी की बात करना चाहता हूँ, डगलस वेलस की, मैं तकरीर नहीं करना चाहता हूँ, जिन्होंने एक चिप ईजाद की है, MIT चिप, माइटोकॉन्ड्रियल चिप, और वो चिप उन्होंने टैग की है हर्ब के साथ और रिडक्शनिस्ट केमिकल के साथ। और दैट स्टडी, द कंक्लूजन ऑफ द स्टडी says that everything, every chemical is rejected inside the body wisdom, I mean, and every natural substance is accepted by the body. So I think बहुत कुछ कहना पड़ेगा, बहुत कुछ करना पड़ेगा जब हम इस टॉपिक के साथ इंसाफ कर सकें। शुक्रिया।
Thank you very much, Dr. Nasir Sahib. I think it's a very relevant topic to raise. One thing is there that apparently in 5 minutes of discussion by the panelists, maybe everything could not be covered. But all these things which you have raised are the points of concern. And I think most of us are well aware of that these things will happen. One of our panelists in the general board has spoken, I think Mr. Sharma Sahib or Sarwar Sahib has spoken that most of the people he mentioned, I think Sharma Sahib mentioned probably that we are more focusing on artificial diets. We are more focusing on fast foods. I think we have to resort back to the traditional foods. So that question, the answer lies of your question in that if we could resort back to those traditional foods, those natural foods, probably all these things which you are raising may not happen. Like you're talking of preservatives, you're not talking of some other components in certain salt permissible. Like, for example, you talked about heavy metals. But as far as the science part of is concerned, I think all the councils, particularly in Ministry of Ayush, I think we all are extra careful. The chairman of Scientific Committee of Pharmacopoeia Commission of Indian System of Medicine and Homeopathy, Professor Sharma, is here on my left. We have made a template, and every time, as per the given needs and requirements of the science, those keep on changing. And based on them, all the researches are being carried out. The pharmaceutical standards which are being developed by the councils, whether this is Unani or Ayurveda or Siddha, they are being carried out based on those formulations, those templates, which are being developed by the multidisciplinary scientist teams. But all the questions which Dr. Nasir Sahib has mentioned, I think they are very relevant, very, very relevant, and we will be taking care of them, and we will definitely address them accordingly. That's for sure.
This is the last question, please.
I am Dr. Ashik Munshi. It is actually not a question, it's just a submission, and I want to use this platform for that. Actually, this question is directly mostly to our director NIUM, Dr. Wadud sir. We are talking much about this diet and nutrition, and Dr. Saab has been very able to get some more courses in the NIUM recently, that pathology and dermatology, all this. But why not this post-graduation diploma in nutrition is being added in that course? Because diet is a very important, it should be incorporated in the disciplines also. This is a submission, not a question. And this platform may be used for that.
So for your kind information, we have already submitted a proposal of deemed to be university to the minister UGC, and if we get the deemed to be university status, we are going to start 5 de novo courses. One of them will be Unani dietetics, Unani cosmetology. So these two postgraduate courses, MSc in dietetics and MSc in cosmetology, will be started, provided we have got the deemed university status.
No, sir.
Thank you.
Moderator sir, 1 second. My point is this: कि with MSc डॉक्टर साहब का जो मुझे पॉइंट समझ आया ये था कि एटलीस्ट यूनानी डॉक्टर्स शुड बी गिवन द प्रेफरेंस, सो दे विल नॉट बी एबल टू.
Sir, I submitted now. The Department of Biochemistry should take care of nutrition part also. So there should be 1 or 2 papers on.
Ayush graduates will also be eligible. So instead of doing a diploma, why not MSc?
Okay, now with this, we have come to this question answer, end of the question answer series. Now I hand over the mic to the chairman of the session, Professor Dr. Asim Saab, to have his final word, and with that we will come to the end of the day.
Thank you very much, Professor Zagar Sahib, Yusuf Sahib, my other co-panelists, Mohan Singh Sahib, Sharma Sahib, and my very strong co-panelists who will join us from online.
Thank you. For sparing time to be with us, and I am putting my apologies on record that we got a bit late, and for that some of our panelists online had to wait. So yes, discussions were very good. Our panelists spoke very relevant points. Let me tell you one thing, and after that probably I will not take much time because we are already late, that Ayush Ministry has already launched a huge series, and we are coming up with Ayush Ahar. That is the diet in Ayush systems, whether this is Ayurveda, Unani, Siddha. And Ayush Ahar has been launched, and we are trying to work is that we are keeping that Ayush diets of different systems in the canteens and other institutions of this way. And we are in a big way, we are going to promote that Ayush Ahar. Unani medicine also in last almost a month or 2 months before, we also had certain diets which we wanted to launch, and we launched also, and we came to trade fair exhibition that was in Delhi, and we took out like harira, or we took out like gulkand, we made murabba amla. So many such things are coming forward with. We have also launched today, we released one book on diet. Ayush Ahar in Ayurveda also has also been taken care of and have been given great importance. So all these things are being worked out, and on dietary aspect of it, because something most of the speakers spoke today, that prevention is better than cure, and diet can play a wonderful role. I think diet has been neglected, and we have in Ayush systems of medicine, diet has to play a very important role. So everybody is refocusing on the diets, including Unani system of medicine, and we are working on it. As far as these aspects which Dr. Nazir Saab has raised, all these things are being taken care of. Further we will focus on them. But as we were discussing after a question, Dr. Sharma Sahib, because all these things they have huge domain, and much work is being carried out, much work need to be done. So that is a process which is going on, but we will definitely look into this. Some of the questions which you raised were very relevant, and we will take care of them. With these words, I'll once again thank all the panelists who have joined us online, and the panelists, my co-panelists and moderators or co-moderators here with me physically who have joined us here, and the audience. Thankful to all the ISM department doctors from the RRIUM, the practitioners of Unani System of Medicine who have joined us offline, online, on the delegates, online delegates, almost 1500 delegates have joined us who are watching us live. Thank you very much for being with us.
Thank you. What a wonderful session we had. And thanks to distinguished moderators for gracing our session with their presence. Professor Asim Ali Khan, DG CCRUM, Ministry of Ayush, Government of India. Professor Akbar Masood, Vice Chancellor, Baba Ghulam Shah Badshah University, Rajouri, J&K. Professor Muhammad Abdul Zargar, Registrar, Central University of Kashmir, J&K. Thank you, sir. Thank you for gracing this whole session with your presence. And I extend thanks to distinguished speakers who made this panel discussion a rich experience for all of us. Thanks to Talat Sahab, Honorable Vice Chancellor, University of Kashmir, who joined us through online mode. Dr. S. Farooq, President, Himalaya Drug Company, New Delhi. Dr. W. Selvamurthy, President, Amity Science and Technology and Innovation Foundation. Dr. Pradeep Multani, Mr. Santosh Joshi, who are representing Dr. Asad Mueed. Dr. M.A. Waheed, Member Governing, Professor Abdul Wadood, who are very much here, and Professor K.M.Y. Amin Sahab, who also joined us through online mode, Professor M.C. Sharma, thank you sir for being here, and Dr. Mohan Singh. And my thanks to all the rapporteurs, thank you so much. Now I would like to request Professor Asim Ali Khan to present a memento as a token of gratitude and appreciation to Professor Akbar Masood, Honorable Vice Chancellor Baba Ghulam Shah Badshah University, Rajouri, J&K. So big round of applause, please. Thank you, sir. Now, sir, please do the honors of presenting memento as a token of gratitude and appreciation to Professor Muhammad Afzal Zargar, Registrar, Central University of Kashmir. So, big round of applause, please. Thank you. Now, sir, please do the honors again to present memento as a token of gratitude to Professor Abdul Wadood Sahab. Please, sir. Put your hands together for the same. Now, sir, please present memento to Professor M.C. Sharma. Big round of applause, please. Thank you, sir. Now, sir, please do the honors of presenting memento to Dr. Mohan Singh and bouquet as well as a token of love and respect. Thank you, sir. Now, I would request Professor Muhammad Afzal Zargar Sahab, Registrar, Central University of Kashmir, to present memento as a token of appreciation and gratitude to Professor Asim Ali Khan. Please, big round of applause. Thank you, sir. Thank you so much. Thanks to all the people for joining us, for making this session a wonderful experience for all of us. Let me tell you, high tea will be served outside, so please have a tea and enjoy. Thank you. We will meet tomorrow, inshallah. That first technical session will start at 10 a.m. 9:30. 9:30 is reporting time. 9:30 is reporting time, and session will get started at 10 a.m. sharp. So please kindly join us on time. Thank you so much. हाँ सर शेड्यूल तो है गजाला मैम से आपको मिले